Hey Alpha Nurses, I'm Licensure from alphanursguy.com. This is 250 practice NCLEX questions. Without delay, let's get started.
A 39-year-old female client has been experiencing intermittent vaginal bleeding for several months. Her physician tells her that she has uterine fibroids and recommends an abdominal hysterectomy. When the client expresses fear about the surgery, the nurse should 1. Reassure the client of her physician's competence. 2. Give the client opportunities to express her fears. 3. Teach the client that fear impedes recovery. 4. Change the topic of conversation. The correct answer is 2. Give the client opportunities to express her fears. The best approach for a client who is fearful about having surgery is to allow the client opportunities to express her fears. Open-ended questions should elicit the client's individual and specific fears. This then gives the nurse the opportunity to provide clarification, information, and support, and possibly to offer other resources. The other actions are not supportive and deny the client the opportunity to express her feelings. The nurse is on a camping trip. A man who is chopping wood gets struck in the eye with a piece of debris. On examination, a wood splinter is protruding from his eyeball. What should the nurse do first? 1. Have the man lie in the back seat of the car and drive him to the emergency department. 2. Gently remove the piece of wood and place a sterile dressing over the eye. 3. Carefully rest a plastic cup on the orbital rim and tape it in place. 4. Flush the eye with copious amounts of clean tepid water, then check visual acuity. The correct answer is 3. Carefully rest a plastic cup on the orbital rim and tape it in place. Penetrating objects should not be removed or disturbed by anyone except an eye specialist because the object may be creating a tamponade effect. Removing or disrupting the object could result in additional damage to the eye. The man needs to have emergency care, and 911 should be called. But if there are no emergency services available, the man should sit in the back seat of the car with a seatbelt in place for transport to the nearest facility. If an eye has been cut or punctured, the bottom of a paper cup taped to the bones surrounding the eye can serve as a shield until you get medical attention. After a penetrating eye injury has been assessed and treated by an ophthalmologist, there is a possibility that based on the ophthalmologist recommendations, foreign body removal, flushing, and dressing application could be accomplished in the emergency department. However, penetrating objects frequently require surgical removal. Antibiotics and a tetanus immunization are administered before the patient is transferred to the operating room. The client experienced an electrical burn that resulted in full-thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates. Which data indicates the fluid resuscitation is effective? 1. The client's urine output is less than 30 milliliter per hour. 2. The client's urine output is at least 50 milliliter per hour. 3. The client's urine output is 75 to 100 milliliter per hour. 4. The client's urine output is greater than 200 milliliter per hour. The correct answer is 3. The client's urine output is 75 to 100 milliliter per hour. The client diagnosed with an electrical burn should have a urine output of 75 to 100 milliliter per hour for the fluid resuscitation to be effective. An output of greater than 100 milliliter per hour would indicate the client is losing too much fluid and that the fluid resuscitation is not effective. Urine output of less than 30 milliliter per hour would not indicate the fluid resuscitation is effective. For option 2, this would indicate effective fluid resuscitation for a client diagnosed with a thermal burn, but not for a client diagnosed with an electrical burn. The parent of an infant with cystic fibrosis asks the nurse how to meet the child's increased nutritional needs. Which is the nurse's best suggestion? 1. You may need to increase the number of fresh fruits and vegetables you give your infant. 2. You may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. 3. You may need to change your infant to a higher calorie formula. 4. You may need to increase your infant's carbohydrate intake. The correct answer is 3. You may need to change your infant to a higher calorie formula. Often, infants with CF need to have a higher calorie formula to meet their nutritional needs. Infants may also be placed on hydrolysate formulas that contain medium-chain triglycerides.
The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care, which of the following statements by the client indicates that the client understands how to implement the plan of care. 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept the prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When assessing the lower extremities of a client with peripheral vascular disease, the nurse notes bilateral ankle edema. The edema is related to 1. Competent venous valves, 2. Decreased blood volume, 3. Increase in muscular activity, 4. Increased venous pressure. The correct answer is 4. Increased venous pressure. In PVD, decreased blood flow can result in increased venous pressure. The increase in venous pressure results in an increase in capillary hydrostatic pressure, which causes a net filtration of fluid out of the capillaries into the interstitial space, resulting in edema. Valves often become incompetent with PVD. Blood volume is not decreased in this condition. Decreased muscular action would contribute to the formation of edema in the lower extremities.
When assessing a client who is receiving tricyclic antidepressant therapy, which of the following should alert the nurse to the possibility that the client is experiencing anticholinergic effects? 1. Tremors and cardiac arrhythmias. 2. Sedation and delirium. 3. Respiratory depression and convulsions. 4. Urine retention and blurred vision. The correct answer is 4. Urine retention and blurred vision. Rationale. Anticholinergic effects, which result from blockage of the parasympathetic nervous system, include urine retention, blurred vision, dry mouth, and constipation. Tremors and cardiac arrhythmias are possible side effects, but they are caused by increased norepinephrine availability. Sedation and delirium are not anticholinergic effects. Sedation may be a therapeutic effect because many clients with depression experience agitation and insomnia. Delirium, typically not a side effect, would indicate toxicity, especially in elderly clients. Respiratory depression, convulsions, ataxia, agitation, stupor, and coma indicate tricyclic antidepressant toxicity.
When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? 1. Inform the supervisor. 2. Give the drug as prescribed. 3. Give the average dose of the medication. 4. Discuss the prescription with the primary healthcare provider. The correct answer is 4. Discuss the prescription with the primary healthcare provider. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice.
The nurse is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1. Identifying environmental factors that increase the risk for falls. 2. Monitoring gait, balance, and fatigue level with ambulation. 3. Collaborating with the physical therapist to provide the patient with a walker. 4. Assisting the patient with ambulation to the bathroom and in the halls. The correct answer is 4. Assisting the patient with ambulation to the bathroom and in the halls. Rationale. Assisting with activities of daily living, including assisting with ambulation to the bathroom and in the halls, is within the scope of the AP's practice. The other 3 interventions require additional educational preparation and are within the scope of practice of licensed nurses. The nurse is monitoring a client after and above the knee amputation and notes that blood has saturated. Through the distal part of the dressing, the nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated.
The nurse is planning care for a client who is diagnosed with peripheral vascular disease and has a history of heart failure. The nurse should develop a plan of care that is based on the fact that the client may have a low tolerance for exercise related to 1. Decreased blood flow. 2. Increased blood flow. 3. Decreased pain. 4. Increased blood viscosity. The correct answer is 1. Decreased blood flow. A client with PVD and heart failure will experience decreased blood flow. In this situation, low exercise tolerance may be related to less blood being ejected from the left ventricle into the systemic circulation. Decreased blood supply to the tissues results in pain. Increased blood viscosity may be a component, but it is of much less importance than the disease processes.
The client with depression who is taking imipramine, tofranil, states to the nurse, "My doctor wants me to have an electrocardiogram in 2 weeks, but my heart is fine." Which response by the nurse is most appropriate? 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. 2. It's probably a precautionary measure because I'm not aware that you have a cardiac condition. 3. Try not to worry too much about this. Your doctor is just being very thorough in monitoring your condition. 4. You had an ECG before you were prescribed imipramine, and the procedure will be the same. The correct answer is 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. Rationale. Telling the client that ECGs are done routinely for all clients taking imipramine, a tricyclic antidepressant, is an honest and direct response. Additionally, it provides some reassurance for the client. Commonly, a client with depression will ruminate, leading to needless increased anxiety. Tricyclic antidepressants may cause tachycardia, ECG changes, and cardiotoxicity. Telling the client that it's probably a precautionary measure because the nurse is not aware of a cardiac condition instills doubt and may cause undue anxiety for the client. Telling the client not to worry because the doctor is very thorough dismisses the client's concern and does not give the client adequate information. Explaining that the client had an ECG before initiating therapy with imipramine and that the procedure will be the same does not answer the client's question.
A nurse administers an incorrect dose of medication to a patient. Which is the primary purpose of documenting this event in an incident report? 1. Record the event for future litigation. 2. Provide a basis for designing new policies. 3. Prevent similar situations from happening again. 4. Ensure accountability for the cause of the accident. The correct answer is 3. Prevent similar situations from happening again. Risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts.
The nurse is preparing a discussion of musculoskeletal health maintenance for a group of older adults. Which key points would the nurse be sure to include? Select all that apply. 1. Be aware of and consume foods rich in calcium and vitamin D. 2. Wear hats and long sleeves to avoid sun exposure at all times. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. 6. Weight-bearing activities decrease the risk for osteoporosis. The correct answers are 1. Be aware of and consume foods rich in calcium and vitamin D. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. And 6. Weight-bearing activities decrease the risk for osteoporosis. Rationale. Many health problems of the musculoskeletal system can be prevented through health promotion strategies and avoidance of risky lifestyle behaviors. Weight-bearing activities, such as walking, can reduce risk factors for osteoporosis and maintain muscle strength. Young men are at the greatest risk for trauma related to motor vehicle crashes. Older adults are at the greatest risk for falls that result in fractures and soft tissue injury. High-impact sports, such as excessive jogging or running, can cause musculoskeletal injury to soft tissues and bone. Tobacco use slows the healing of musculoskeletal injuries. Excessive alcohol intake can decrease vitamins and nutrients a person needs for bone and muscle tissue growth. Hats and long sleeves are recommended to prevent sunburn, but the nurse would recommend 20 minutes of sun exposure several times a week for vitamin D, which contributes to bone health. A client has undergone an amputation of 3 toes and a femoral popliteal bypass. The nurse should teach the client that after surgery, which of the following leg positions is contraindicated while sitting in a chair? 1. Crossing the legs. 2. Elevating the legs. 3. Flexing the ankles. 4. Extending the knees. The correct answer is 1. Leg crossing is contraindicated because it causes adduction of the hips and decreases the flow of blood into the lower extremities. This may result in increased pressure in the graft in the affected leg. Elevating the legs, flexing the ankles, and extending the knees are not necessarily contraindicated.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client admitted with peripheral vascular disease asks the nurse why her legs hurt when she walks. The nurse bases a response on the knowledge that the main characteristic of PVD is 1. Decreased blood flow. 2. Increased blood flow. 3. Slow blood flow. 4. Thrombus formation. The correct answer is 1. Decreased blood flow. Decreased blood flow is a common characteristic of all PVD. When the demand for oxygen to the working muscles becomes greater than the supply, pain is the outcome. Slow blood flow throughout the circulatory system may suggest pump failure. Thrombus formation can result from stasis or damage to the intima of the vessels.
When preparing a teaching plan for a client about imipramine, tofranil, which of the following substances should the nurse tell the client to avoid while taking the medication? 1. Caffeinated coffee. 2. Sunscreen. 3. Alcohol. 4. Artificial tears. The correct answer is 3. Alcohol. Rationale. Imipramine, a tricyclic antidepressant in combination with alcohol, will produce additive central nervous system depression. Although caffeinated coffee is safe to use when the client is taking imipramine, it is not recommended for a client with depression who may be experiencing sleep disturbances. Imipramine may cause photosensitivity, so the client would be instructed to use sunscreen and protective clothing when exposed to the sun. Reduced lacrimation may occur as a side effect of imipramine. Therefore, the use of artificial tears may be recommended.
When a nurse is administering a medication to a confused patient, The patient says, "This pill looks different from the one I had before." Which should the nurse do? 1. Ask what the other pill looked like. 2. Explain the purpose of the medication. 3. Check the original medication prescription. 4. Encourage the patient to take the medication. The correct answer is 3. Check the original medication prescription. Option 3 is the safest intervention because it goes to the original source of the prescription. Option 2 ignores the patient's concern. Option 1 is unsafe because the patient is confused and the information obtained may be inaccurate. Option 4 ignores the patient's statement and is unsafe without first obtaining additional information.
The nurse is caring for a patient who had a dual energy X-ray absorptiometry scan and is now prescribed calcium with vitamin D twice a day. The patient asked the nurse the purpose of this drug. What is the nurse's best response? Select all that apply. 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 2. When your vitamin D level is high, your bones release calcium to keep your blood calcium level in the normal range. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. 4. When blood calcium is normal, long bones are formed, increasing a person's height. 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. 6. You can also get extra vitamin D by increasing your intake of beef and pork sources. The correct answers are 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. And 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. Rationale: vitamin D and its metabolites are produced in the body and transported in the blood to promote the absorption of calcium and phosphorus from the small intestine. There is a relationship between calcium and phosphorus, so that if a patient's phosphorus level is higher than normal, the calcium level will drop and vice versa. A decrease in the body's vitamin D level can result in osteomalacia, softening a bone, in an adult. When serum calcium levels are lowered, parathyroid hormone secretion increases and stimulates bone to promote osteoclastic activity and release calcium to the blood. PTH reduces the renal excretion of calcium and facilitates its absorption from the intestine. Sources of vitamin D include sunlight, fatty fish, and vitamin D in rich foods. The client asks the nurse, "Why can't the doctor tell me exactly how much of my leg they're going to take off? Don't you think I should know that?" The nurse responds, knowing that the final decision on the level of the amputation will depend primarily on 1. The need to remove as much of the leg as possible. 2. The adequacy of the blood supply to the tissues. 3. The ease with which a prosthesis can be fitted. 4. The client's ability to walk with a prosthesis. The correct answer is 2. The level of amputation commonly cannot be accurately determined until surgery, when the surgeon can directly assess the adequacy of the circulation of the residual limb. A longer residual limb facilitates prosthesis fitting and will make it easier for the client to walk. However, although these aspects will be considered in the final decision, they are not the primary factors influencing the decision.
A client is receiving cilostazol for peripheral arterial disease causing intermittent claudication. The nurse determines this medication is effective when the client reports which of the following? 1. I am having fewer aches and pains. 2. I do not have headaches anymore. 3. I am able to walk further without leg pain. 4. My toes are turning grayish-black in color. The correct answer is 3. I am able to walk further without leg pain. Cilostazol is indicated for management of intermittent claudication. Symptoms usually improve within 2 to 4 weeks of therapy. Intermittent claudication prevents clients from walking for long periods of time. Cilostazol inhibits platelet aggregation induced by various stimuli and improving blood flow to the muscles and allowing the client to walk long distances without pain. Peripheral arterial disease causes pain mainly of the leg muscles. Aches and pains does not specify exactly where the pain is occurring. Headaches may occur as a side effect of this drug, and the client should report this information to the healthcare provider. Peripheral arterial disease causes decreased blood supply to the peripheral tissues and may cause gangrene of the toes. The drug is effective when the toes are warm to the touch and the color of the toes is similar to the color of the body.
Which of the following outcomes should the nurse include in the initial plan of care for a client who is exhibiting psychomotor retardation, withdrawal, minimal eye contact, and unresponsiveness to the nurse's questions? 1. The client will initiate interactions with peers. 2. The client will participate in milieu activities. 3. The client will discuss adaptive coping techniques. 4. The client will interact with the nurse. The correct answer is 4. The client will interact with the nurse. Rationale. In the initial plan of care, the most appropriate outcome would be that the client will interact with the nurse. First, the client would begin interacting with one individual, the nurse. The nurse would gradually assist the client to engage in interactions with other clients in one-on-one contacts, progressing toward informal group gatherings and eventually taking part in structured group activities. The client needs to experience success according to the client's level of tolerance. Initiating interactions with peers occurs when the client can gain a measure of confidence and self-esteem instead of feeling intimidated or unduly anxious. Discussing adaptive coping techniques is an outcome the client may be able to reach when symptoms are not as severe and the client can concentrate on improving coping skills.
An infant with heart failure is receiving diuretic therapy, and the nurse is closely monitoring the intake and output. Which is the best method for the nurse to use to monitor the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The correct answer is 1. Weighing the diapers. The best method to monitor urine output in an infant on diuretic therapy is to weigh the diapers. The weight of dry diapers is subtracted from the weight of wet diapers to determine the amount of urine excreted. 1 gram is equivalent to 1 milliliter of urine. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the best method and places the infant at risk for infection.
The nurse is assisting with a student assessment screening of 6th graders at the local grade school. A student presents with a back and spine, as in the following illustration. What is the nurse's best interpretation of this finding? 1. Dupuytren contracture. 2. Cole's fracture. 3. Scoliosis. 4. Lordosis. The correct answer is 3. Scoliosis. Rationale. Scoliosis occurs when the vertebrae rotate and begin to compress. The spinal column moves into a lateral curve. On assessment, findings include asymmetry of hip and shoulder height with prominent thoracic ribs and scapula on one side. Dupuytren contracture is a hand deformity with slow progressive thickening of the palmar fascia leading to flexion contracture of the 4th and 5th fingers. Cole's fracture occurs in the distal radius. Lordosis is a loss of lumbar curvature sometimes called flat back, which may also be present with scoliosis. While the nurse is providing preoperative teaching for a client with peripheral vascular disease who is to have a below-the-knee amputation, the client says, "I hate the idea of being an invalid after they cut off my leg." The nurse's most therapeutic response should be, 1. You'll still have one good leg to use. 2. Tell me more about how you're feeling. 3. Let's finish the preoperative teaching. 4. You're fortunate to have a wife who can take care of you. The correct answer is 2. Encouraging the client who is undergoing amputation to verbalize feelings is the most therapeutic nursing intervention. By eliciting concerns, the nurse may be able to provide information to help the client cope. The nurse should avoid value-laden responses, such as, "You'll still have one good leg," that may make the client feel guilty or hostile and block further communication. The nurse should not ignore the client's expressed concerns, nor should the nurse reinforce the client's concern about invalidism and dependency, or assume that his wife is willing to care for him.
The nurse is caring for a client with peripheral artery disease who has recently been prescribed clopidogrel. The nurse understands that more teaching is necessary when the client states which of the following. 1. I should not be surprised if I bruise easier or if my gums bleed a little when brushing my teeth. 2. It doesn't really matter if I take this medicine with or without food, whatever works best for my stomach. 3. I should stop taking Plavix if it makes me feel weak and dizzy. 4. The doctor prescribed this medicine to make my platelets less likely to stick together and help prevent clots from forming. The correct answer is 3. I should stop taking Plavix if it makes me feel weak and dizzy. Weakness, dizziness, and headache are common adverse effects of Plavix, and the client should report these to the physician if they are problematic. In order to decrease risk of clot formation, Plavix must be taken regularly and should not be stopped or taken intermittently. The main adverse effect of Plavix is bleeding, which often occurs as increased bruising or bleeding when brushing teeth. Plavix is well absorbed, and while food may help decrease potential gastrointestinal upset, Plavix may be taken with or without food. Plavix is an antiplatelet agent used to prevent clot formation in clients who have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome.
Which of the following behaviors exhibited by a client with depression should lead the nurse to determine that the client is ready for discharge? 1. Interactions with staff and peers. 2. Sleeping for 4 hours in the afternoon and 4 hours at night. 3. Verbalization of feeling in control of self and situations. 4. Statements of dissatisfaction over not being able to perform at work. The correct answer is 3. Verbalization of feeling in control of self and situations. Rationale. The client who verbalizes feeling in control of self and situations no longer feels powerless to affect an outcome, but realizes that one's actions can have an impact on self and situations. It is common for the client with depression to feel powerless to affect an outcome and to feel a lack of control over a situation. Although interacting with staff and peers is a positive action, the client could be conversing in a negative or non-therapeutic manner. Sleeping 4 hours in the afternoon and 4 hours at night is evidence of symptomatology and does not indicate improvement or recovery. Verbalizing dissatisfaction over not being able to perform at work indicates that the client is most likely focusing on shortcomings and powerlessness.
The nurse is caring for a child with a diagnosis of Kawasaki disease. The mother of the child asks the nurse about the disorder. Which statement most accurately describes Kawasaki disease? 1. It is an acquired cell-mediated immunodeficiency disorder. 2. It is a chronic multisystem autoimmune disease characterized by the inflammation of connective tissue. 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. 4. It is an inflammatory autoimmune disease that affects the connective tissue of the heart, joints, and subcutaneous tissues. The correct answer is 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. Kawasaki disease, also called mucocutaneous lymph node syndrome, is a febrile generalized vasculitis of unknown etiology. Option 1 describes human immunodeficiency virus infection. Option 2 describes systemic lupus erythematosus. Option 4 describes rheumatic fever. A client from a Mediterranean country is admitted with thalassemia, jaundice, splenomegaly, and hepatomegaly. Which of the following should be the primary focus of nursing care for this client? 1. Providing activities of daily living on the time schedule of the client's homeland. 2. Offering foods that the client enjoys in order to increase the intake of calories. 3. Decreasing cardiac demands by promoting rest. 4. Listening to concerns about the hospitalization. The correct answer is 3. Decreasing cardiac demands by promoting rest. This client has clinical manifestations of thalassemia major, a disease found in descendants from the Mediterranean Sea area whose mother and father both possess a gene for thalassemia. The severe hemolytic anemia causes sequestration of red blood cells in the spleen and liver, which leads to engorgement of the organs and chronic bone marrow hyperplasia. Rest will decrease the demands on the heart due to the diminished hemoglobin level, a physiologic concern. The nurse should follow the time schedule of the area in which the client is now living. The nurse can help the client prescribe preferred foods and listen to concerns, but the main priority is to decrease oxygen demands.
The client with peripheral vascular disease and a history of hypertension is to be discharged on a low-fat, low cholesterol, low-sodium diet, which should be the nurse's first step in planning the dietary instructions. 1. Determine the client's knowledge level about cholesterol. 2. Ask the client to name foods high in fat, cholesterol, and salt. 3. Explain the importance of complying with the diet. 4. Assess the family's food preferences. The correct answer is 4. Before beginning dietary interventions, the nurse must assess the client's pattern of food intake, lifestyle, food preferences, and ethnic, cultural, and financial influences.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. An overweight client taking warfarin has dry skin due to decreased arterial blood flow. What should the nurse instruct the client to do? Select all that apply. 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. 4. Instruct the client to limit activities of daily living. 5. Use an electric razor to shave. The correct answers are 1. Apply lanolin or petroleum jelly to intact skin. 2. Follow a reduced-calorie, reduced-fat diet. 3. Inspect the involved areas daily for new ulcerations. And 5. Use an electric razor to shave. Maintaining skin integrity is important in preventing chronic ulcers and infections. The client should be taught to inspect the skin on a daily basis. The client should reduce weight to promote circulation. A diet lower in calories and fat is appropriate. Because the client is receiving Coumadin, the client is at risk for bleeding from cuts. To decrease the risk of cuts, the nurse should suggest that the client use an electric razor. The client with decreased arterial blood flow should be encouraged to participate in ADLs. In fact, the client should be encouraged to consult an exercise physiologist for an exercise program that enhances the aerobic capacity of the body.
After administering a prescribed medication to a client who becomes restless at night and has difficulty falling asleep, which of the following nursing actions is most appropriate? 1. Sitting quietly with the client at the bedside until the medication takes effect. 2. Engaging the client in interaction until the client falls asleep. 3. Reading to the client with the lights turned down low. 4. Encouraging the client to watch television until the client feels sleepy. The correct answer is 1. Sitting quietly with the client at the bedside until the medication takes effect. Rationale: to promote adequate rest, 6 to 8 hours per night, and to eliminate hypersomnia, the nurse should sit with the client at the bedside until the medication takes effect. The presence of a caring nurse provides the client with comfort and security and helps to decrease the client's anxiety. Engaging the client in interaction until the client falls asleep, reading to the client, or encouraging the client to watch television may be too stimulating for the client, consequently increasing rather than decreasing the client's restlessness.
The nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results. Which laboratory study should assist in confirming the diagnosis of rheumatic fever? 1. Immunoglobulin. 2. Red blood cell count. 3. Antistreptolysin O titer. 4. White blood cell count. The correct answer is 3. Antistreptolysin O titer. A diagnosis of rheumatic fever is confirmed by the presence of 2 major manifestations, or 1 major and 2 minor manifestations from the Jones criteria. In addition, evidence of a recent streptococcal infection is confirmed by a positive antistreptolysin O titer streptozyme or an anti-DNase B assay. Options 1, 2, and 4 will not assist in confirming the diagnosis of rheumatic fever. A client is to have a Schilling test. The nurse should 1. Administer methylcellulose. 2. Start a 24 to 48-hour urine specimen collection. 3. Maintain nothing by mouth status. 4. Start a 72-hour stool specimen collection. The correct answer is 2. Start a 24 to 48-hour urine specimen collection. Urinary vitamin B12 levels are measured after the ingestion of radioactive vitamin B12. A 24 to 48-hour urine specimen is collected after administration of an oral dose of radioactively tagged vitamin B12 and an injection of non-radioactive vitamin B12. In a healthy state of absorption, excess vitamin B12 is excreted in the urine. In a malabsorptive state, or when the intrinsic factor is missing, vitamin B12 is excreted in the feces. Methylcellulose is a bulk-forming agent. Laxatives interfere with the absorption of vitamin B12. The client is NPO 8 to 12 hours before the test, but is not NPO during the test. A stool collection is not a part of the Schilling test. If stool contaminates the urine collection, the results will be altered.
A client with peripheral vascular disease is recovering from an aortofemoral popliteal bypass graft when developing a postoperative education plan. Which question by the nurse will provide the most helpful information? 1. How did you manage your health before admission? 2. How far could you walk without pain before surgery? 3. What is your home environment like? 4. Do you have problems with urine retention? The correct answer is 1. Assessing the individual's health behavior before surgery will help the nurse and client develop strategies to manage the postoperative course. Asking open-ended questions will elicit the most helpful information. The client's ability to walk after surgery will be improved after surgery. The nurse can ask direct questions after obtaining general information.
A client with peripheral vascular disease has undergone a right femoral popliteal bypass graft. The blood pressure has decreased from 124 over 80 to 94 over 62. What should the nurse assess first? 1. IV fluid solution. 2. Pedal pulses. 3. Nasal cannula flow rate. 4. Capillary refill. The correct answer is 2. Pedal pulses. With each set of vital signs, the nurse should assess the dorsalis pedis and posterior tibial pulses. The nurse needs to ensure adequate perfusion to the lower extremity with the drop in blood pressure. IV fluids, nasal cannula setting, and capillary refill are important to assess. However, priority is to determine the cause of drop in blood pressure and that adequate perfusion through the new graft is maintained.
A female client with severe depression and weight loss has not eaten since admission to the hospital 2 days ago. Which of the following approaches should the nurse include when developing this client's plan of care to ensure that she eats? 1. Serving the client her meal trays in her room. 2. Sitting with the client and spoon feeding if required. 3. Calling the family to bring the client food from home. 4. Explaining the importance of nutrition in recovery. The correct answer is 2. Sitting with the client and spoon feeding if required. Rationale. A depressed client commonly is not interested in eating because of the psychopathology of the disorder. Therefore, the nurse must take responsibility to ensure that the client eats, including spoon feeding the client if necessary. Serving the client her tray in her room does not ensure that she will eat. Calling the family to bring the client food from home usually is allowed, but it is still the nurse's responsibility to ensure that the client eats. Explaining the importance of nutrition in recovery is not helpful. The client may intellectually know that eating is important, but may not be interested in eating or want to eat.
Prostaglandin E1 is prescribed for a child with transposition of the great arteries. The mother of the child asks the nurse why the child needs the medication. The nurse correctly responds that which is the purpose of this medication. 1. Maintains an adequate hormone level. 2. Prevents hypercyanotic spells. 3. Maintains the position of the great arteries. 4. Provides adequate oxygen saturation and maintains cardiac output. The correct answer is 4. Provides adequate oxygen saturation and maintains cardiac output. A child with transposition of the great arteries may receive prostaglandin E1 temporarily to increase blood mixing if systemic and pulmonary mixing are inadequate to maintain adequate cardiac output. Options 1, 2, and 3 are incorrect. In addition, hypercyanotic spells occur in tetralogy of Fallot. When a client is receiving a cephalosporin, the nurse must monitor the client for which of the following? 1. Drug-induced hemolytic anemia. 2. Purpura. 3. Infectious emboli. 4. Ecchymosis. The correct answer is 1. Drug-induced hemolytic anemia. Drug-induced hemolytic anemia is acquired, antibody-mediated, RBC destruction precipitated by medications such as cephalosporins, sulfa drugs, rifampin, methyldopa, procainamide, quinidine, and thiazide. Purpura is a condition with various manifestations characterized by hemorrhages into the skin, mucous membranes, internal organs, and other tissues. Infectious emboli are clumps of bacteria present in blood or lymph. Ecchymoses are skin discolorations due to extravasations of blood into the skin or mucous membranes.
A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first 1. Initiate the rapid response team. 2. Contact the physician. 3. Encourage the client to relax. 4. Document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxifylline, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxifylline. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed.
The nurse is assessing a 48-year-old client with a history of smoking during a routine clinic visit. The client, who exercises regularly, reports having pain in the calf during exercise that disappears at rest. Which of the following findings requires further evaluation? 1. Heart rate 57 beats per minute. 2. Oxygen saturation of 94% on room air. 3. Blood pressure 134/82. 4. Ankle brachial index of 0.65. The correct answer is 4. Ankle brachial index of 0.65. An ankle brachial index of 0.65 suggests moderate arterial vascular disease in a client who is experiencing intermittent claudication. A Doppler ultrasound is indicated for further evaluation. The bradycardic heart rate is acceptable in an athletic client with a normal blood pressure. The oxygen saturation is acceptable. The client has a smoking history.
A client is taking phenelzine, Nardil, 15 milligrams PO 3 times a day. The nurse is about to administer the 1 p.m. dose when the client tells the nurse about having a throbbing headache. Which of the following should the nurse do first? 1. Give the client an analgesic, prescribed PRN. 2. Call the primary healthcare provider to report the symptom. 3. Administer the client's next dose of phenelzine. 4. Obtain the client's vital signs. The correct answer is 4. Obtain the client's vital signs. Rationale. The nurse should first take the client's vital signs because the client could be experiencing a hypertensive crisis, which requires prompt intervention. Signs and symptoms of a hypertensive crisis include occipital headache, a stiff or sore neck, nausea, vomiting, sweating, dilated pupils and photophobia, nosebleed, tachycardia, bradycardia, and constricting chest pain. Giving this client an analgesic without taking his vital signs first is inappropriate. After the client's vital signs have been obtained, then the nurse would call the primary healthcare provider to report the client's problems and vital signs. Administering the client's next dose of phenelzine for taking his vital signs could result in a dangerous situation if the client is experiencing a hypertensive crisis.
The nurse is assigned to care for an infant with a diagnosis of tricuspid atresia. The nurse plans care, knowing which is true regarding this diagnosis. 1. A single vessel overrides both ventricles. 2. Frequent episodes of hypercyanotic spells occur. 3. There is no communication from the right atrium to the right ventricle. 4. There is no communication from the systemic and pulmonary circulations. The correct answer is 3. There is no communication from the right atrium to the right ventricle. In tricuspid atresia, there is no communication from the right atrium to the right ventricle. Option 1 describes truncus arteriosus. Option 4 describes transposition of the great arteries. In Option 2, frequent episodes of hypercyanotic spells occur in tetralogy of Fallot. A client has fatigue, temperature of 37.5 degrees Celsius, dark bronze skin, and dark urine. Hemoglobin is 9 grams per deciliter, hematocrit is 49, and red blood cells are 2.75 million per microliter. What should the nurse do first? 1. Initiate an intake and output record. 2. Place the client on bed rest. 3. Place the client on contact isolation. 4. Keep the client out of sunlight. The correct answer is 1. Initiate an intake and output record. The nurse should prepare to start an intake and output record because the client is exhibiting clinical manifestations of anemia with jaundice and is demonstrating a fluid imbalance. The client does not need to be on bed rest at this point. The client is not contagious and does not need to be placed in contact isolation. The changes in the color of the skin and urine are related to the jaundice and will not be affected by sunlight.
A client with peripheral vascular disease, coronary artery disease, and chronic obstructive pulmonary disease takes theophylline 200 milligrams twice daily every day and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the client's 1. Digoxin level, 2. Partial thromboplastin time, 3. Serum cholesterol level, 4. Theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. An elderly client had posterior packing inserted to control a severe nosebleed. After insertion of the packing, the client should be closely monitored for which of the following complications? 1. Vertigo. 2. Bell's palsy. 3. Hypoventilation. 4. Loss of gag reflex. The correct answer is 3. Hypoventilation. Posterior packing may alter the respiratory status of the client, especially in elderly clients, causing hypoventilation. Clients should be observed carefully for changes in level of consciousness, respiratory rate, and heart rate and rhythm after the insertion of the packing. Vertigo does not occur as a result of the insertion of posterior packing. Bell's palsy, a disorder of the 7th cranial nerve, is not associated with epistaxis or nasal packing. Loss of gag reflex does not occur as a result of the insertion of posterior packing.
When teaching the client with atypical depression about foods to avoid while taking phenelzine, which of the following should the nurse include? 1. Roasted chicken. 2. Salami. 3. Fresh fish. 4. Hamburger. The correct answer is 2. Salami. Rationale. Phenelzine is a monoamine oxidase inhibitor. MAOIs block the enzyme monoamine oxidase, which is involved in the decomposition and inactivation of norepinephrine, serotonin, dopamine, and tyramine. Foods high in tyramine. Those that are fermented, pickled, aged, or smoked must be avoided because when they are ingested in combination with MAOIs, a hypertensive crisis occurs. Some examples include salami, bologna, dried fish, sour cream, yogurt, aged cheese, bananas, pickled herring, caffeinated beverages, chocolate, licorice, beer, red wine, and alcohol-free beer.
The nurse is preparing to administer digoxin to an infant with heart failure. Before administering the medication, the nurse double-checks the dose, counts the apical heart rate for 1 full minute, and obtains a rate of 88 beats per minute. Based on this finding, which is the appropriate nursing action? 1. Withhold the medication. 2. Administer the medication. 3. Double-check the apical heart rate and administer the medication. 4. Check the blood pressure and respiration and administer the medication. The correct answer is 1. Withhold the medication. Digoxin is effective within a narrow therapeutic range. Safety in dosing is achieved by double-checking the dose and counting the apical heart rate for 1 full minute. If the heart rate is less than 100 beats per minute in an infant, the nurse should withhold the dose and notify the healthcare provider. The remaining options are incorrect actions. A client is admitted from the emergency department after falling down a flight of stairs at home. The client's vital signs are stable, and the history states that the client had a gastric stapling 2 years ago. The client jokes about being clumsy lately and tripping over things. The nurse should ask the client which of the following questions? Select all that apply. 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? 4. Do you feel safe at home? 5. Are you getting sufficient iron in your diet? The correct answers are 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? And 4. Do you feel safe at home? The nurse should ask the client about symptoms related to pernicious anemia because the client had the stomach stapled 2 years ago and shows no history of supplemental vitamin B12. Numbness and tingling relate to a loss of intrinsic factor from the gastric stapling. Intrinsic factor is necessary for absorption of vitamin B12. The nurse should suspect pernicious anemia if the client is not taking supplemental vitamin B12. Other signs and symptoms of pernicious anemia include cognitive problems and depression. The nurse also should ask about the client's support at home in case the fall was not an accident. Pernicious anemia is not related to dietary intake of iron.
A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client, 1. Has improved circulation in the legs, 2. Can wiggle the toes, 3. Is urinating more frequently, 4. Is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome.
The nurse is teaching a client how to manage a nosebleed. Which of the following instructions would be appropriate to give the client? 1. Tilt your head backward and pinch your nose. 2. Lie down flat and place an ice compress over the bridge of the nose. 3. Blow your nose gently with your neck flexed. 4. Sit down, lean forward, and pinch the soft portion of your nose. The correct answer is 4. Sit down, lean forward, and pinch the soft portion of your nose. The client should assume a sitting position and lean forward. Firm pressure should be applied to the soft portion of the nose for approximately 10 minutes. Tilting the head backward can cause the client to swallow blood, which can obscure the amount of bleeding and also can lead to nausea. Ice compresses may be applied, but the client should not lie flat. Blowing the nose is to be avoided because it can increase bleeding.
The client states to the nurse, I take citalopram, Celexa, 40 milligrams every day as my primary healthcare provider prescribed. I have also been taking St. John's wort 750 milligrams daily for the past 2 weeks. Which of the following indicate that the client is developing serotonin syndrome? Select all that apply. 1. Confusion. 2. Restlessness. 3. Constipation. 4. Diaphoresis. 5. Ataxia. The correct answers are 1. Confusion, 2. Restlessness. 4. Diaphoresis. And 5. Ataxia. Rationale. Serotonin syndrome can occur if a selective serotonin reuptake inhibitor is combined with a monoamine oxidase inhibitor, a tryptophan serotonin precursor, or St. John's wort. Signs and symptoms of serotonin syndrome include mental status changes, such as confusion, restlessness or agitation, headache, diaphoresis, ataxia, myoclonus, shivering, tremor, diarrhea, nausea, abdominal cramps, and hyperreflexia. Constipation is not associated with serotonin syndrome.
A healthcare provider has prescribed oxygen as needed for a 10-month-old infant with heart failure. In which situation should the nurse administer the oxygen to the child? 1. When the child is sleeping. 2. When changing the child's diapers. 3. When the mother is holding the child. 4. When drawing blood for electrolyte levels. The correct answer is 4. When drawing blood for electrolyte levels. Oxygen administration may be prescribed for the infant with HF for stressful periods, especially during bouts of crying or invasive procedures. Drawing blood is an invasive procedure that would likely cause the child to cry. Which position would most help to decrease a client's discomfort when the client's spouse injects vitamin B12 using the ventrogluteal site? 1. Lying on the side with legs extended. 2. Lying on the abdomen with toes pointed inward. 3. Leaning over the edge of a low table with hips flexed. 4. Standing upright with the feet one shoulder width apart. The correct answer is 2. Lying on the abdomen with toes pointed inward. To promote comfort when injecting at the ventrogluteal site, the position of choice is with the client lying on the abdomen with toes pointed inward. This positioning promotes muscle relaxation, which decreases the discomfort of making an injection into a tense muscle. Lying on the side with legs extended will not provide the greatest muscle relaxation. Leaning over the edge of a table with the hips flexed and standing upright with the feet apart will increase muscular tension.
The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety. 2. Sedation. 3. Vasoconstriction. 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease.
Which of the following activities should the nurse teach the client to implement after the removal of nasal packing on the second post-operative day? 1. Avoid cleaning the nares until swelling has subsided. 2. Apply water-soluble jelly to lubricate the nares. 3. Keep a nasal drip pad in place to absorb secretions. 4. Use a bulb syringe to gently irrigate nares. The correct answer is 2. Apply water-soluble jelly to lubricate the nares. After removal of nasal packing, the client should be instructed to apply water-soluble jelly to the nares to lubricate the nares and promote comfort. Swelling gradually subsides over several weeks. The client can gently clean the nares as soon as packing is removed. A nasal drip pad is not needed after removal of packing. Irrigation with a bulb syringe may interfere with healing and introduce infection.
The client who has been taking venlafaxine Effexor 25 milligrams PO 3 times a day for the past 2 days states, "This medicine isn't doing me any good. I'm still so depressed." Which of the following responses by the nurse is most appropriate? 1. Perhaps we'll need to increase your dose. 2. Let's wait a few days and see how you feel. 3. It takes about 2 to 4 weeks to receive the full effects. 4. It's too soon to tell if your medication will help you. The correct answer is 3. It takes about 2 to 4 weeks to receive the full effects. Rationale. The client needs to be informed of the time lag involved with antidepressant therapy. Although improvement in the client's symptoms will occur gradually over the course of 1 to 2 weeks, typically it takes 2 to 4 weeks to get the full effects of the medication. This information will help the client be compliant with medication and will also help in decreasing any anxiety the client has about not feeling better. The client's dose may not need to be increased. It is too early to determine the full effectiveness of the drug. Additionally, such a statement may increase the client's anxiety and diminish self-worth. Telling the client to wait a few days discounts the client's feelings and is inappropriate. Although it is too soon to tell whether the medication will be effective, telling this to the client may cause the client undue distress. This statement is somewhat negative because it is possible that the medication will not be effective, possibly further compounding the client's anxiety about not feeling better.
The nurse provides home care instructions to the parents of a child with heart failure regarding the procedure for the administration of digoxin. Which statement by a parent indicates the need for further teaching? 1. I will not mix the medication with food. 2. If more than one dose is missed, I will call the healthcare provider. 3. I will take my child's pulse before administering the medication. 4. If my child vomits after medication administration, I will repeat the dose. The correct answer is 4. If my child vomits after medication administration, I will repeat the dose. The parents need to be instructed that if the child vomits after the digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. Additionally, the parents should be instructed that if a dose is missed and it is not noticed until 4 hours later, the dose should not be administered. A physician prescribes vitamin B12 for a client with pernicious anemia. Which sites are appropriate for the nurse to administer vitamin B12? Select all that apply. 1. Median cutaneous. 2. Greater femur trochanter. 3. Acromion muscle. 4. Ventrogluteal. 5. Upper back. 6. Dorsogluteal. The correct answers are 4. Ventrogluteal and 6. Dorsogluteal. A client with pernicious anemia has lost the ability to absorb vitamin B12 either because of the lack of an acidic gastric environment or the lack of the intrinsic factor. Vitamin B12 must be administered by a deep intramuscular route. The ventrogluteal and dorsogluteal locations are the most acceptable sites for a deep intramuscular injection. The other sites are not acceptable.
The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing, 2. Jogging, 3. Golfing, 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is being discharged with nasal packing in place. The nurse should instruct the client to 1. Perform frequent mouth care. 2. Use normal saline nose drops daily. 3. Sneeze and cough with mouth closed. 4. Gargle every 4 hours with salt water. The correct answer is 1. Perform frequent mouth care. Frequent mouth care is important to provide comfort and encourage eating. Mouth care promotes moist mucous membranes. Nose drops cannot be used with nasal packing in place. When sneezing and coughing, the client should do so with the mouth open to decrease the chance of dislodging the packing. Gargling should not be attempted with packing in place.
A client with major depression is to be discharged home tomorrow. When preparing the client's discharge plan, which of the following areas is most important for the nurse to review with the client? 1. Future plans for going back to work. 2. A conflict encountered with another client. 3. Results of psychological testing. 4. Medication management with outpatient follow-up. The correct answer is 4. Medication management with outpatient follow-up. Rationale. Medication management with outpatient follow-up is of vital importance to discuss with the client before discharge. The nurse teaches and clarifies any questions related to medication and outpatient treatment. The client also has the opportunity to voice feelings related to medication and treatment. The goal is to assist the client in making a successful transition from hospital to home with optimal functioning outside the hospital for as long as possible. The nurse may also need to assist with decreasing any anxiety the client may have related to discharge. Discussing future plans for returning to work or employment is not as immediate a concern as assisting with medication and treatment compliance. Noncompliance with medication is a primary cause of relapse in a client with a psychiatric disorder. Reviewing a conflict the client had encountered with another client is not appropriate or therapeutic at this time unless the client brings it to the nurse's attention. The conflict should have been dealt with and resolved when it occurred. Reviewing the results of psychological testing is the responsibility of the primary healthcare provider if he chooses.
The nurse monitors the daily weight of an infant with heart failure. Which finding alerts the nurse to suspect fluid accumulation and thus the need to notify the charge nurse? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. The correct answer is 4. A weight gain of 1 pound in 1 day. A weight gain of 0.5 kilogram or 1 pound in 1 day is a result of the accumulation of fluid. The nurse should monitor the urine output, monitor for evidence of facial or peripheral edema, check the lung sounds, and report the weight gain. Tachypnea and an increased blood pressure would occur with fluid accumulation. Diaphoresis is a sign of HF, but it is not specific to fluid accumulation, and it usually occurs with exertional activities. A client was admitted to the hospital with iron deficiency anemia and blood-streaked emesis. Which question is most appropriate for the nurse to ask in determining the extent of the client's activity intolerance? 1. What daily activities were you able to do 6 months ago compared with the present? 2. How long have you had this problem? 3. Have you been able to keep up with all your usual activities? 4. Are you more tired now than you used to be? The correct answer is 1. What daily activities were you able to do 6 months ago compared with the present? It is difficult to determine activity intolerance without objectively comparing activities from one time frame to another. Because iron deficiency anemia can occur gradually and individual endurance varies, the nurse can best assess the client's activity tolerance by asking the client to compare activities 6 months ago and at present. Asking a client how long a problem has existed is a very open-ended question that allows for too much subjectivity for any definition of the client's activity tolerance. Also, the client may not even identify that a problem exists. Asking the client whether he is staying abreast of usual activities addresses whether the tasks were completed, not the tolerance of the client while the tasks were being completed, or the resulting condition of the client after the tasks were completed. Asking the client if he is more tired now than usual does not address his activity tolerance. Tiredness is a subjective evaluation and again can be distorted by factors such as the gradual onset of the anemia or the endurance of the individual.
One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested.
After nasal surgery, the client expresses concern about how to decrease facial pain and swelling while recovering at home. Which of the following discharge instructions would be most effective for decreasing pain and edema? 1. Take analgesics every 4 hours around the clock. 2. Use corticosteroid nasal spray as needed to control symptoms. 3. Use a bedside humidifier while sleeping. 4. Apply cold compresses to the area. The correct answer is 4. Apply cold compresses to the area. Applying cold compresses helps to decrease facial swelling and pain from edema. Analgesics may decrease pain, but they do not decrease edema. A corticosteroid nasal spray would not be administered post-operatively because it can impair healing. Use of a bedside humidifier promotes comfort by providing moisture for nasal mucosa, but it does not decrease edema.
The client with recurring depression will be discharged from the psychiatric unit. Which suggestion to the family is best to help them prepare for the client's return home? 1. Discourage visitors while the client is at home. 2. Provide for a schedule of activities outside the home. 3. Involve the client in usual at-home activities. 4. Encourage the client to sleep as much as possible. The correct answer is 3. Involve the client in usual at-home activities. Rationale. It is best to involve the client in usual at-home activities as much as the client can tolerate them. Discouraging visitors may not be in the client's best interest because visits with supportive significant others will help reinforce supportive relationships, which are important to the client's self-worth and self-esteem. Providing for a schedule of activities outside the home may be overwhelming for the client initially. Involving the client in planning for outside activities would be appropriate. Encouraging the client to sleep as much as possible is non-therapeutic and promotes withdrawal from others.
The nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of heart failure. The nurse should observe for which early sign of heart failure? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The correct answer is 3. Tachycardia. The early signs of rheumatic fever include tachycardia, tachypnea, profuse scalp sweating, fatigue, irritability, sudden weight gain, and respiratory distress. A cough may occur with HF as a result of mucosal swelling and irritation, but it is not an early sign. Pallor may be noted in the infant with heart failure, but it is also not an early sign. A client who follows a vegetarian diet was referred to a dietitian for nutritional counseling for anemia. Which client outcome indicates that the client does not understand nutritional counseling? The client: 1. Adds dried fruit to cereal and baked goods. 2. Cooks tomato-based foods in iron pots. 3. Drinks coffee or tea with meals. 4. Adds vitamin C to all meals. The correct answer is 3. Drinks coffee or tea with meals. Coffee and tea increase gastrointestinal motility and inhibit the absorption of non-heme iron. Clients are instructed to add dried fruits to dishes at every meal because dried fruits are a non-heme or non-animal iron source. Cooking in iron cookware, especially acid-based foods such as tomatoes, adds iron to the diet. Clients are instructed to add a rich supply of vitamin C to every meal because the absorption of iron is increased when food with vitamin C or ascorbic acid is consumed.
A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. the nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time.
Which of the following assessments is a priority immediately after nasal surgery? 1. Assessing the client's pain. 2. Inspecting for periorbital ecchymosis. 3. Assessing respiratory status. 4. Measuring intake and output. The correct answer is 3. Assessing respiratory status. Immediately after nasal surgery, ineffective breathing patterns may develop as a result of the nasal packing and nasal edema. Nasal packing may dislodge, leading to obstruction. Assessing for airway obstruction is a priority. Assessing for pain is important, but it is not as high a priority as assessment of the airways. It is too early to detect ecchymosis. Measuring intake and output is not typically a priority nursing assessment after nasal surgery.
When developing the teaching plan for the family of a client with severe depression who is to receive electroconvulsive therapy, ECT, which of the following information should the nurse include? 1. Some temporary confusion and disorientation immediately after treatment is common. 2. During an ECT treatment session, the client is at risk for aspiration. 3. Clients with severe depression usually do not respond to ECT. 4. The client will not be able to breathe independently during a treatment. The correct answer is 1. Some temporary confusion and disorientation immediately after a treatment is common. Rationale. The family needs to be informed that some confusion and disorientation will occur as the client emerges from anesthesia immediately after ECT to lessen their fear and anxiety about the procedure. The nurse will assist the client with reorientation and will give clear, simple instructions. The client may need to lie down after ECT because of the effects of the anesthesia. Informing the family that there is a danger of aspiration during ECT is inappropriate and unnecessary. The risk of aspiration occurring during ECT is minimal because food and fluids are withheld for 6 to 8 hours before the treatment. In addition, the client receives atropine to inhibit salivation and respiratory tract secretions. Telling the family that the client will not be able to breathe independently during ECT may frighten them unnecessarily. If asked, the nurse should inform the family that the anesthesiologist mechanically ventilates the client with 100% oxygen immediately before the treatment. The client with severe depression responds to ECT. Usually, ECT is used for those who are severely depressed and not responding to pharmacotherapy.
The nurse assists with admitting a child with a diagnosis of acute stage Kawasaki disease. When obtaining the child's medical history, which manifestation is likely to be noted? 1. Cracked lips. 2. A normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The correct answer is 3. Conjunctival hyperemia. During the acute stage of Kawasaki disease, the child presents with fever, conjunctival hyperemia, a red throat, swollen hands, a rash, and enlargement of the cervical lymph nodes. During the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. During the convalescent stage, the child appears normal, but signs of inflammation may be present. A client had a resection of the terminal ileum 3 years ago. While obtaining a health history and physical assessment, the nurse finds that the client has weakness, shortness of breath, and a sore tongue. Which additional information from the client indicates a need for intervention and client teaching? 1. I have been drinking plenty of fluids. 2. I have been gargling with warm salt water for my sore tongue. 3. I have 3 to 4 loose stools per day. 4. I take a vitamin B12 tablet every day. The correct answer is 4. I take a vitamin B12 tablet every day. Vitamin B12 combines with intrinsic factor in the stomach and is then carried to the ileum, where it is absorbed into the bloodstream. In this situation, vitamin B12 cannot be absorbed regardless of the amount of oral intake of sources of vitamin B12, such as animal protein or vitamin B12 tablets. Vitamin B12 needs to be injected every month because the ileum has been surgically removed. Replacement of fluids and electrolytes is important when the client has continuous multiple loose stools on a daily basis. Warm salt water is used to soothe sore mucous membranes. Crohn's disease and a small bowel resection may cause several loose stools a day.
The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning. Before the client gets out of bed, the stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stocking should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is planning to give preoperative instructions to a client who will be undergoing rhinoplasty. Which of the following instructions should be included? 1. After surgery, nasal packing will be in place for 7 to 10 days. 2. Normal saline nose drops will need to be administered preoperatively. 3. The results of the surgery will be immediately obvious post-operatively. 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. The correct answer is 4. Aspirin-containing medications should not be taken for 2 weeks before surgery. Aspirin-containing medications should be discontinued for 2 weeks before surgery to decrease the risk of bleeding. Nasal packing is usually removed the day after surgery. Normal saline nose drops are not routinely administered preoperatively. The results of the surgery will not be obvious immediately after surgery because of edema and ecchymosis.
A male client who is very depressed exhibits psychomotor retardation, a flat affect, and apathy. The nurse observes the client to be in need of grooming and hygiene. Which of the following nursing actions is most appropriate? 1. Explaining the importance of hygiene to the client. 2. Asking the client if he is ready to shower. 3. Waiting until the client's family can participate in the client's care. 4. Stating to the client that it's time for him to take a shower. The correct answer is 4. Stating to the client that it's time for him to take a shower. Rationale: the client with depression is preoccupied, has decreased energy, and cannot make decisions, even simple ones. Therefore, the nurse presents the situation, it's time for a shower, and assists the client with personal hygiene to preserve his dignity and self-esteem. Explaining the importance of good hygiene to the client is inappropriate because the client may know the benefits of hygiene, but is too fatigued and preoccupied to pay attention to self-care. Asking the client if he is ready for a shower is not helpful because the client with depression commonly cannot make even simple decisions. This action also reinforces the client's feeling about not caring about showering. Waiting for the family to visit to help with the client's hygiene is inappropriate and irresponsible on the part of the nurse. The nurse is responsible for making basic decisions for the client until the client can make decisions for himself.
Acetyl-salicylic acid is prescribed for a child with rheumatic fever. The nurse should question this prescription if the child had documented evidence of which condition? 1. Arthralgia. 2. Joint pain. 3. Facial edema. 4. A viral infection. The correct answer is 4. A viral infection. Anti-inflammatory agents, including aspirin, may be prescribed by the healthcare provider for the child with RF. Aspirin should not be given to a child who has chickenpox or other viral infections, such as influenza, because of the risk of Reyes syndrome. Options 1 and 2 are clinical manifestations of RF. Facial edema may be associated with the development of a cardiac complication. The nurse devises a teaching plan for the client with aplastic anemia. Which of the following is the most important concept to teach for health promotion and maintenance? 1. Eat animal protein and dark green, leafy vegetables every day. 2. Avoid exposure to others with acute infections. 3. Practice yoga and meditation to decrease stress and anxiety. 4. Get 8 hours of sleep at night and take naps during the day. The correct answer is 2. Avoid exposure to others with acute infections. Clients with aplastic anemia are severely immunocompromised and at risk for infection and possible death related to bone marrow suppression and pancytopenia. Strict aseptic technique and reverse isolation are important measures to prevent infection. Although diet, reduced stress, and rest are valued in supporting health, the potentially fatal consequence of an acute infection places it as a priority for teaching the client about health maintenance. Animal meat and dark green leafy vegetables, good sources of vitamin B12 and folic acid, should be included in the daily diet. Yoga and meditation are good complementary therapies to reduce stress. 8 hours of rest and naps are good for spacing and pacing activity and rest.
A client with peripheral vascular disease has bypass surgery. The primary goal of the plan of care after surgery is to 1. Maintain circulation. 2. Prevent infection. 3. Relieve pain. 4. Provide education. The correct answer is 1. Maintaining circulation in the affected extremity after surgery is the focus of care. The graft can become occluded, and the client must be assessed frequently to determine whether the graft is patent. Preventing infection and relieving pain are important, but are secondary to maintaining graft patency. Education should have taken place in the preoperative phase, and then continued during the recovery phase.
Which of the following statements should indicate to the nurse that a client has understood the discharge instructions provided after nasal surgery? 1. I should not shower until my packing is removed. 2. I will take stool softeners and modify my diet to prevent constipation. 3. Coughing every 2 hours is important to prevent respiratory complications. 4. It is important to blow my nose each day to remove the dried secretions. The correct answer is 2. I will take stool softeners and modify my diet to prevent constipation. Constipation can cause straining during defecation, which can induce bleeding. Showering is not contraindicated. The client should take measures to prevent coughing, which can cause bleeding. The client should avoid blowing the nose for 48 hours after the packing is removed. Thereafter, the client should blow the nose gently, using the open mouth technique to minimize bleeding in the surgical area.
During a group session, a client who is depressed tells the group that he lost his job. Which of the following responses by the nurse is best? 1. It must have been very upsetting for you. 2. Would you tell us about your job? 3. You'll find another job when you're better. 4. You were probably too depressed to work. The correct answer is 1. It must have been very upsetting for you. Rationale. By stating, it must have been very upsetting for you, the nurse conveys empathy to the client by recognizing the underlying meaning of a painful occurrence. The nurse's statement invites the client to verbalize feelings and thoughts and lets the client know that the nurse is listening to and respects the client. Telling the client to talk about the job disregards the client's feelings and is non-therapeutic for the depressed client because of underlying feelings of worthlessness and guilt that are commonly present. Telling the client that he will find another job when he is better or that he was probably too depressed to work is inappropriate because it disregards the client's feelings and may promote additional feelings of failure and inadequacy in the client.
The nurse is told that a child with rheumatic fever will be arriving to the nursing unit for admission. Which question should the nurse ask the family to elicit information specific to the development of RF? 1. Has the child complained of back pain? 2. Has the child complained of headaches? 3. Has the child had any nausea or vomiting? 4. Did the child have a sore throat or a fever within the past 2 months? The correct answer is 4. Did the child have a sore throat or a fever within the past 2 months. Rheumatic fever characteristically presents 2 to 6 weeks after an untreated or partially treated Group A beta hemolytic streptococcal infection of the upper respiratory tract. Initially, the nurse determines if the child has had a sore throat or an unexplained fever within the past 2 months. Options 1, 2, and 3 are unrelated to RF. Which of the following lab values should the nurse report to the healthcare provider when the client has anemia? 1. Schilling test result, elevated. 2. Intrinsic factor, absent. 3. Sedimentation rate, 16 millimeters per hour. 4. Red blood cells within normal range. The correct answer is 2. Intrinsic factor, absent. The defining characteristic of pernicious anemia, a megaloblastic anemia, is lack of the intrinsic factor, which results from atrophy of the stomach wall. Without the intrinsic factor, vitamin B12 cannot be absorbed in the small intestine, and folic acid needs vitamin B12 for deoxyribonucleic acid synthesis of RBCs. The gastric analysis is done to determine the primary cause of the anemia. An elevated excretion of the injected radioactive vitamin B12, which is protocol for the first and second stages of the Schilling test, indicates that the client has the intrinsic factor and can absorb vitamin B12 in the intestinal tract. A sedimentation rate of 16 millimeters per hour is normal for both men and women and is a non-specific test to detect the presence of inflammation. It is not specific to anemias. An RBC value within the normal range does not indicate an anemia.
A client who has been diagnosed with peripheral vascular disease is being discharged. The client needs further instruction, as she says she will 1. Avoid heating pads. 2. Not cross the legs. 3. Wear leather shoes. 4. Use iodine on an injured site. The correct answer is 4. The client should avoid using iodine or over-the-counter medications. Iodine is a highly toxic solution. An individual who has known PVD should be seen by a physician for treatment to avoid infection. The client with PVD should avoid heating pads and crossing the legs and should wear leather shoes. A heating pad can cause injury, which, because of the decreased blood supply, can be difficult to heal. Crossing the legs can further impede blood flow. Leather shoes provide better protection.
A client who has undergone outpatient nasal surgery is ready for discharge and has nasal packing in place. Which of the following discharge instructions would be appropriate for the client? 1. Avoid activities that elicit the Valsalva maneuver. 2. Take aspirin to control nasal discomfort. 3. Avoid brushing the teeth until the nasal packing is removed. 4. Apply heat to the nasal area to control swelling. The correct answer is 1. Avoid activities that elicit the Valsalva maneuver. The client should be instructed to avoid any activities that cause Valsalva's maneuver, such as constipation, vigorous coughing, exercise, in order to reduce bleeding and stress on suture lines. The client should not take aspirin because of its antiplatelet properties, which may cause bleeding. Oral hygiene is important to rid the mouth of old dried blood and to enhance the client's appetite. Cool compresses, not heat, should be applied to decrease swelling and control discoloration of the area.
A 62-year-old female client with severe depression and psychotic symptoms is scheduled for electroconvulsive therapy tomorrow morning. The client's daughter asks the nurse, "How painful will the treatment be for mom?" The nurse should respond by saying which of the following? 1. Your mother will be given something for pain before the treatment. 2. The primary healthcare provider will make sure your mother doesn't suffer needlessly. 3. Your mother will be asleep during the treatment and will not be in pain. 4. Your mother will be able to talk to us and tell us if she's in pain. The correct answer is 3. Your mother will be asleep during the treatment and will not be in pain. Rationale. The nurse should explain that ECT is a safe treatment and that the client is given an ultra-short-acting anesthetic to induce sleep before ECT and a muscle relaxant to prevent musculoskeletal complications during the convulsion, which typically lasts 30 to 60 seconds to be therapeutic. Atropine is given before ECT to inhibit salivation and respiratory tract secretions and thereby minimize the risk of aspiration. Medication for pain is not necessary and is not given before or during the treatment. Some clients experience a headache after the treatment and may request and be given an analgesic such as acetaminophen. Telling the daughter that the primary healthcare provider will ensure that the client does not suffer needlessly would not provide accurate information about ECT. This statement also implies that the client will have pain during the treatment, which is untrue.
The nurse has reinforced home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement by the mother indicates the need for further teaching? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities during which the child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after this surgery. The correct answer is 2. I can apply lotion or powder to the incision if it is itchy. The mother should be instructed that lotions and powders should not be applied to the incision site because these items can affect the skin integrity and the healing process. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. The nurse has just admitted a 35-year-old female client who has a serum vitamin B12 concentration of 800 picograms per milliliter. Which of the following laboratory findings should alert the nurse to focus the health history to obtain specific information about drug or alcohol use? 1. Total bilirubin, 0.3 milligrams per deciliter. 2. Serum creatinine, 0.5 milligrams per deciliter. 3. Hemoglobin, 16 grams per deciliter. 4. Folate, 1.5 nanograms per milliliter. The correct answer is 4. Folate, 1.5 nanograms per milliliter. Normal range of folic acid is 1.8 to 9 nanograms per milliliter, and normal range of vitamin B12 is 200 to 900 picograms per milliliter. A low folic acid level in the presence of a normal vitamin B12 level is indicative of a primary folic acid deficiency anemia. Factors that affect the absorption of folic acid are drugs such as methotrexate, oral contraceptives, anti-seizure drugs, and alcohol. The total bilirubin, serum creatinine, and hemoglobin values are within normal limits.
A client with peripheral vascular disease has chronic, severe pretibial and ankle edema bilaterally. Because the client is on complete bed rest and circulation is compromised, one goal is to maintain tissue integrity. Which of the following interventions will help achieve this outcome? 1. Administering pain medication. 2. Encouraging fluids. 3. Turning the client every 1 to 2 hours. 4. Maintaining hygiene. The correct answer is 3. The client is at greater risk for skin breakdown in the lower extremities related to the edema and to remaining in one position, which increases capillary pressure. Turning the client every 1 to 2 hours promotes vasodilation and prevents vascular compression. Administering pain medication will not have an effect on skin integrity. Encouraging fluids is not a direct intervention for maintaining skin integrity, although being well hydrated is a goal for most clients. Maintaining hygiene does influence skin integrity, but is secondary in this situation.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client has had surgery for a deviated nasal septum. Which of the following would indicate that bleeding was occurring even if the nasal drip pad remained dry and intact? 1. Nausea. 2. Repeated swallowing. 3. Increased respiratory rate. 4. Increased pain. The correct answer is 2. Repeated swallowing. Because of the dense nasal packing, bleeding may not be apparent through the nasal drip pad. Instead, the blood may run down the throat, causing the client to swallow frequently. The back of the throat, where the blood will be apparent, can be assessed with a flashlight. An accumulation of blood in the stomach can cause nausea and vomiting, but nausea would not be the initial indicator of bleeding. An increased respiratory rate occurs in shock, but is not an early sign of bleeding in a client who has undergone nasal surgery. Increased pain warrants further assessment, but is not an indicator of bleeding.
Which of the following statements by a client taking trazodone deserel, as prescribed by the primary healthcare provider, indicates to the nurse that further teaching about the medication is needed? 1. I will continue to take my medication after a light snack. 2. Taking deserel at night will help me to sleep. 3. My depression will be gone in about 5 to 7 days. 4. I won't drink alcohol while taking deserel. The correct answer is 3. My depression will be gone in about 5 to 7 days. Rationale. Symptom relief can occur during the first week of therapy, with optimal effects possible within 2 weeks. For some clients, 2 to 4 weeks is needed for optimal effects. The client statement that the depression will be gone in 5 to 7 days indicates to the nurse that clarification and further teaching is needed. Trazodone should be taken after a meal or light snack to enhance its absorption. Trazodone can cause drowsiness, and therefore the major portion of the drug should be taken at bedtime. The depressant effects of central nervous system depressants and alcohol may be potentiated by this drug.
The nurse reviews the record of a child who was just seen by a healthcare provider. The HCP has documented a diagnosis of suspected aortic stenosis. Which specific sign-symptom of aortic stenosis should the nurse anticipate? 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The correct answer is 3. Exercise intolerance. The child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but it is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. The nurse should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? 1. Whole grains. 2. Green leafy vegetables. 3. Meats and dairy products. 4. Broccoli and Brussels sprouts. The correct answer is 3. Meats and dairy products. Good sources of vitamin B12 include meats and dairy products. Whole grains are a good source of thiamine. Green leafy vegetables are good sources of niacin, folate, and carotenoids, which are precursors of vitamin A. Broccoli and Brussels sprouts are good sources of ascorbic acid, which is vitamin C.
The nurse is planning care for elderly clients who are affected by orthostatic hypotension. The nurse should do which of the following? Select all that apply. 1. Assist the clients to stand to help prevent falls. 2. Teach clients how to gradually change their position. 3. Request a prescription for antihypertensive medications for clients at high risk. 4. Conduct fall risk assessments. 5. Consider the use of sequential compression devices for high-risk clients. 6. Place clients on bed rest. The correct answers are 1, 2, 4, and 5. Orthostatic hypotension is a drop in blood pressure that occurs when changing position, usually to a more upright position. Orthostatic hypotension often occurs in elderly clients, and it is a common cause of falls. Nurses must assess clients for orthostatic hypotension and assist all clients with orthostatic hypotension in standing to help prevent falls. Lower limb compression devices aid in prevention of decreased orthostatic systolic blood pressure and reduce symptoms in elderly clients with progressive orthostatic hypotension. Nurses must teach clients how to gradually change their position, and they must conduct fall risk assessments. Sequential compression devices may be helpful to high-risk clients and should be considered when developing the care plan. Antihypertensive medications are not necessary for clients with orthostatic hypertension and may precipitate dangerous drops in blood pressure. The client should be encouraged to be ambulatory.
A healthcare provider has just inserted nasal packing for a client with epistaxis. The client is taking ramipril for hypertension. What should the nurse instruct the client to do? 1. Use 81 milligrams of aspirin daily for relief of discomfort. 2. Omit the next dose of ramipril. 3. Remove the packing if there is difficulty swallowing. 4. Avoid rigorous aerobic exercise. The correct answer is 4. Avoid rigorous aerobic exercise. Epistaxis, or nosebleed, is a common, sudden emergency. Commonly, no apparent explanation for the bleeding is known. With significant blood loss, systemic symptoms such as vertigo, increased pulse, shortness of breath, decreased blood pressure, and pallor will occur. Because aerobic exercise may increase blood pressure and increased blood pressure can cause epistaxis, the client with hypertension should avoid it. Aspirin inhibits platelet aggregation, reducing the ability of the blood to clot. The client should continue to take his anti-hypertension medication, Ramipril. Posterior nasal packing should be left in place for 1 to 3 days.
The nursing team consists of a nurse in charge, a licensed nurse, and a nursing assistant. Which task should be delegated to a licensed nurse rather than the nursing assistant? Select all that apply. 1. Obtaining routine vital signs. 2. Providing discharge teaching. 3. Ambulating a stable client in the hall. 4. Transporting a client to another location for an X-ray examination. The correct answer is 2. Providing discharge teaching. Rationale. Discharge teaching requires the knowledge and judgment of a licensed nurse. It requires synthesizing and summarizing information, as well as coordinating a variety of community healthcare services to meet client needs. Taking routine vital signs is not complex, has little potential for harm, requires only simple problem-solving skills, involve a simple level of interaction with the client, and is within the scope of practice of a nursing assistant. Taking vital signs requires the more advanced competencies of a licensed nurse when previous vital signs have been outside the expected range, the client is unstable, or the client is transferred from one service/unit to another. Ambulating a stable client in the hall is within the scope of practice of a nursing assistant and does not require the educational skill of a nurse. Transporting a client is not a complex task. It requires simple problem-solving skills and involves a predictable outcome and a simple level of interaction with the client. It does not require the more advanced competencies of a nurse.
The nurse is caring for a nulliparous client who attended Lamaze childbirth education classes. Which of the following techniques should the nurse include in her plan of care? Select all that apply. 1. Hypnotic suggestion. 2. Rhythmic chanting. 3. Muscle relaxation. 4. Pelvic rocking. 5. Abdominal massage. The correct answers are 3. Muscle relaxation, 4. Pelvic rocking, and 5. Abdominal massage. Hypnotic suggestion is usually not included in childbirth education based on the Lamaze method. Rhythmic chanting is usually not included in childbirth education based on the Lamaze method. Muscle relaxation is an integral part of Lamaze childbirth education. Pelvic rocking is taught in Lamaze classes as a way of easing back pain during pregnancy and labor. Abdominal massage, called effleurage, is also an integral part of Lamaze childbirth education. The nurse is preparing to teach a client with microcytic hypochromic anemia about the diet to follow after discharge. Which of the following foods should be included in the diet? 1. Eggs. 2. Lettuce. 3. Citrus fruits. 4. Cheese. The correct answer is 1. Eggs. One of the microcytic hypochromic anemias is iron deficiency anemia. A rich source of iron is needed in the diet, and eggs are high in iron. Other foods high in iron include organ and muscle meats, shellfish, shrimp, and tuna. Enriched, whole grain, and fortified cereals and breads, legumes, nuts, dried fruits and beans, oatmeal, and sweet potatoes. Dark green, leafy vegetables and citrus fruits are good sources of vitamin C. Cheese is a good source of calcium.
The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? 1. Give the report face-to-face with both nurses in a quiet room. 2. Audio tape the report for future reference and documentation. 3. Use a printed checklist with information individualized for the client. 4. Document essential transfer information in the client's electronic health record. The correct answer is 3. Using an individualized, printed checklist ensures that all key information is reported. The checklist can then serve as a record to which nurses can refer later. Giving a verbal report leaves room for error in memory. Using an audio tape or an electronic health record requires nurses to spend unnecessary time retrieving information.
Pseudoephedrine has been prescribed as a nasal decongestant. Which of the following is a possible adverse effect of this drug? 1. Constipation. 2. Bradycardia. 3. Diplopia. 4. Restlessness. The correct answer is 4. Restlessness. Adverse effects of pseudoephedrine are experienced primarily in the cardiovascular system and through sympathetic effects on the central nervous system. The most common CNS adverse effects include restlessness, dizziness, tension, anxiety, insomnia, and weakness. Common cardiovascular adverse effects include tachycardia, hypertension, palpitations, and arrhythmias. Constipation and diplopia are not adverse effects of pseudoephedrine. Tachycardia, not bradycardia, is an adverse effect of pseudoephedrine.
A nurse and a nursing assistant are working together on a surgical unit. Which activity should the nurse assign to the nursing assistant? Select all that apply. 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 3. Explaining to a client how to use an incentive spirometer. 4. Changing the linens on beds that are occupied by clients who are on bed rest. 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. The correct answers are 1. Taking vital signs of clients who are stable. 2. Delivering meal trays to clients who are in isolation. 4. Changing the linens on beds that are occupied by clients who are on bed rest. And 5. Emptying a urine collection bag that is attached to continuous bladder irrigation. Rationale. Taking vital signs of clients who are stable is within the scope of practice of a nursing assistant. Determining the significance of the results of routine vital signs requires the expertise of a nurse. Delivering meal trays to clients who are in isolation is within the scope of practice of a nursing assistant. Nursing assistants are taught how to use personal protective equipment. Changing the linens on beds that are occupied by clients who are on bed rest is within the scope of practice of a nursing assistant. The activity is simple and repetitive. Emptying and recording the volume of output collected from a urine collection bag is within the legal role of a nursing assistant. The nurse will then calculate the volume of urine by deducting the volume of irrigating solution instilled from the total output. Calculating the actual urine output is an assessment that requires the skill of a nurse. Client teaching is within the legal scope of a nurse, not a nursing assistant. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable and it has the potential to cause harm if the skill is taught incorrectly.
1 hour ago, a multipara was examined with the following results: 8 centimeters, 50% effaced, and plus 1 station. She is now pushing with contractions, and the fetal head is seen at the vaginal introitus. The nurse concludes that the client is now 1. 9 centimeters dilated, 70% effaced, and plus 2 station. 2. 9 centimeters dilated, 80% effaced, and plus 3 station. 3. 10 centimeters dilated, 90% effaced, and plus 4 station. 4. 10 centimeters dilated, 100% effaced, and plus 5 station. The correct answer is 4. 10 centimeters dilated, 100% effaced, and plus 5 station. In option 1 and 2, this client is still in stage 1, which is when the cervix is not fully effaced or fully dilated, and the station is high. In option 3, although this client is fully dilated, the cervix is not fully effaced, and the baby has not descended far enough. In option 4, the cervix is fully dilated and fully effaced, and the baby is low enough to be seen through the vaginal introitus. A client has been admitted with active rectal bleeding and has been typed and cross-matched for 2 units of packed red blood cells. Within 10 minutes of admission, the client faints when getting up to go to the bedside commode. The nurse notifies the healthcare provider, who prescribes a unit of blood to be administered immediately. The nurse can safely administer which type of blood for immediate transfusion? 1. A negative. 2. B negative. 3. AB negative. 4. O negative. The correct answer is 4. O negative. A routine serology study to confirm compatibility between a blood donor and recipient takes about 1 hour. In an emergency, O negative RBCs can be safely administered to most clients, which is why a person with O negative blood is called a universal donor. The other types of RBCs may cause an adverse reaction.
The nurse is tracking data on a group of clients with heart failure who have been discharged from the hospital and are being followed at a clinic, which the following data indicate that nursing interventions of monitoring and teaching have been effective. 1. 90% of clients have not gained weight. 2. 75% of the clients viewed the educational video. 3. 80% of the clients reported that they are taking their medications. 4. 5% of the clients required hospitalization in the last 90 days. The correct answer is 4. The goals of managing clients outside of the hospital are for the clients to maintain health and prevent readmission, thus interventions, such as monitoring and teaching, appear to have contributed to the low readmission rate in this group of clients. Although it is important that clients do not gain weight, view educational material, and continue to take their medication, the primary indicator of effectiveness of the program is the lack of rehospitalization.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Guaifenesin 300 milligrams 4 times a day has been prescribed as an expectorant. The dosage strength of the liquid is 200 milligrams per 5 milliliter. How many milliliters should the nurse administer for each dose? Blank milliliters. The correct answer is 7.5 milliliters. To solve this problem, you set up the formula as 200 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 200 times x and 300 times 5. You get 200x equals to 1,500. You divide 200 on both sides, and you get x equals to 7.5 milliliters. This is the amount that the nurse should administer for each dose.
Place the following steps of the decision-making process in the order in which they should be implemented by a nurse. 1. Identify possible solutions to the problem. 2. Gather relevant information. 3. Identify the problem. 4. Evaluate the result. 5. Test the solution. The correct order is 3. Identify the problem. 2. Gather relevant information. 1. Identify possible solutions to the problem. 5. Test the solution. And 4. Evaluate the result. Rationale. The first step in the decision-making process is defining and describing the problem. The second step in the decision-making process is gathering significant information associated with the problem. The third step of the decision-making process is identifying promising strategies to resolve the problem. The fourth step of the decision-making process is implementing an action to address the problem. The fifth step of the decision-making process is evaluating the results by comparing the actual outcomes to the expected outcomes of the employed solution to the problems.
On examination of a full-term primipara, a labor nurse notes, active labor, right occiput anterior, 7 centimeters dilated, and plus 3 station. Which of the following should the nurse report to the healthcare provider? 1. Descent is progressing well. 2. Fetal head is not yet engaged. 3. Vaginal delivery is imminent. 4. External rotation is complete. The correct answer is 1. Descent is progressing well. The presenting part is 3 centimeters below the ischial spines. Descent is progressing well. The fetal head is well past engagement. Engagement is defined as 0 station. The woman, a primipara, is only 7 centimeters dilated. Delivery is likely to be many hours away. External rotation does not occur until after delivery of the fetal head. A client is to have a transfusion of packed red blood cells from a designated donor. The client asks if any diseases can be transmitted by this donor. The nurse should inform the client that which of the following diseases can be transmitted by a designated donor. Select all that apply. 1. Epstein-Barr virus. 2. Human immunodeficiency virus. 3. Cytomegalovirus. 4. Hepatitis A. 5. Malaria. The correct answers are 1. Epstein-Barr virus, 2. Human immunodeficiency virus, and 3. Cytomegalovirus. Using designated donors does not decrease the risk of contracting infectious diseases, such as the Epstein-Barr virus, HIV, or CMV. Hepatitis A is transmitted by the oral fecal route, not the blood route. However, hepatitis B and C can be contracted from a designated donor. Malaria is transmitted by mosquitoes.
The nurse is assessing a client with heart failure who is receiving home health care monitoring using electronic devices, including scales, blood pressure monitoring, and structured questions to which the client responds daily on a touchscreen monitor. The nurse reviews data obtained within the last 3 days. The nurse calls the client to follow up. The nurse should ask the client which of the following first. 1. How are you feeling today? 2. Are you having shortness of breath? 3. Did you calibrate the scales before using them? 4. How much fluid did you drink during the last 24 hours? The correct answer is 2. The client has gained 5 pounds in 3 days with a steady increase in blood pressure. The client is exhibiting signs of heart failure, and if the client is short of breath, this will be another sign. Asking how the client is feeling is too general, and a more focused question will quickly determine the client's current health status. The scales should be calibrated periodically, but a 5 pounds weight gain, along with increased blood pressure, is not likely due to problems with the scale. The weight gain is likely due to fluid retention, not drinking too much fluid.
A client with allergic rhinitis asks the nurse what to do to decrease the rhinorrhea. Which of the following instructions would be appropriate for the nurse to give the client? 1. Use your nasal decongestant spray regularly to help clear your nasal passages. 2. Ask the doctor for antibiotics. Antibiotics will help decrease the secretion. 3. It is important to increase your activity. A daily brisk walk will help promote drainage. 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. The correct answer is 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. It is important for clients with allergic rhinitis to determine the precipitating factors so that they can be avoided. Keeping a diary can help identify these triggers. Nasal decongestant sprays should not be used regularly because they can cause a rebound effect. Antibiotics are not appropriate for allergic rhinitis because an infection is not present. Increasing activity will not control the client's symptoms. In fact, walking outdoors may increase them if the client is allergic to pollen.
A client is to be discharged from the hospital. Which discharge task can be delegated to a nursing assistant? Select all that apply. 1. Teaching the client how to measure weight using a standing scale. 2. Obtaining the client's temperature, pulse, and respiratory rate. 3. Determining if the client knows how to measure fluid intake. 4. Demonstrating to the client how to safely use a walker. 5. Reviewing foods that are high in vitamin C. The correct answer is 2. Obtaining the client's temperature, pulse, and respiratory rate. Rationale. Teaching a client how to obtain a body weight requires the knowledge and judgment of a nurse. Teaching requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. In addition, the outcome is unpredictable, and it has the potential to cause harm if the skill is taught incorrectly. Obtaining vital signs can be delegated to a nursing assistant because it is not a complex task. It requires simple problem-solving skills and a simple level of interaction with the client. Although this task has the potential to cause harm if the critical elements of the skill are not implemented appropriately, It is within the scope of practice of a nursing assistant. It does not require the more advanced competencies of a nurse. Assessing a client's level of understanding is a complex task that requires knowledge and judgment and is within the scope of practice of a nurse. This task requires a complex level of interaction with the client, problem solving, and innovation in the form of an individually designed teaching plan of care that addresses the specific learning needs of the client. Teaching a client how to use a walker requires the knowledge and judgment of a nurse. Reviewing foods that are high in vitamin C requires the knowledge and judgment of a nurse.
When performing Leopold maneuvers, the nurse notes that the fetus is in the left occiput anterior position, which is the best position for the nurse to place a fetoscope to hear the fetal heartbeat. 1. Left upper quadrant. 2. Right upper quadrant. 3. Left lower quadrant. 4. Right lower quadrant. The correct answer is 3. Left lower quadrant. The left upper quadrant would be the appropriate place to place a fetoscope to hear the fetal heartbeat if the baby were in the left sacrum anterior position, not the left occiput anterior position. The right upper quadrant would be appropriate if the baby were in the right sacrum anterior position. The fetoscope should be placed in the left lower quadrant for a fetus positioned in the left occiput anterior position as described in the question. The right lower quadrant would be appropriate if the baby were in the right occiput anterior position. A client had a mastectomy followed by chemotherapy 6 months ago. She reports that she is now unable to concentrate at her card game, and it seems harder and harder to finish her errands because of exhaustion. Based on this information, the nurse should suggest that the client do which of the following? 1. Take frequent naps. 2. Limit activities. 3. Increase fluid intake. 4. Avoid contact with others. The correct answer is 1. Take frequent naps. This client is likely experiencing fatigue and should increase her periods of rest. The fatigue may be caused by anemia from depletion of red blood cells due to the chemotherapy. Asking the client to limit her activities may cause the client to become withdrawn. The information given does not support limiting activity. Increasing fluid intake will not reduce the fatigue. The information does not indicate that the client is immunosuppressed and should avoid contact with others.
The nursing assistant reports to the nurse that a client is feeling short of breath. The client's blood pressure was 124/78 2 hours ago with a heart rate of 82. The nursing assistant reports that blood pressure is now 84/44 with a heart rate of 54, and the client stated, "I just don't feel good." Which of the following interventions should the nurse initiate? Select all that apply. 1. Confirm the client's vital signs and complete a quick assessment. 2. Inform the charge nurse of the change in condition and initiate the hospital's rapid/emergency response team. 3. Make a quick check on other assigned clients before spending the amount of time required to take care of this client. 4. Position client in semi-Fowler's position. 5. Stay with the client and reassure the client. 6. Call the physician and report the situation using SBAR format. The correct answers are 1, 2, 4, 5, and 6. The nurse must have assessment data and verify vital signs if necessary in order to determine the action that is required. If there is a significant change in the client's condition, the charge nurse should be notified in order to help the nurse with both this client and the nurse's other assigned clients if necessary. Most acute care facilities have a rapid response team that can also help assess and intervene with basic standing orders if necessary. Positioning the client in semi-Fowler's is a nursing action that may assist in breathing and relieve shortness of breath. It is important for the nurse to reassure the client by staying calm and remaining with the client. The physician must be notified of the change in client's condition. The nurse must have all information available and present it to the physician in a concise and accurate manner using SBAR format, including a recommendation for treatment if indicated. The nurse should stay with this client and delegate checking on other assigned clients to the charge nurse or nursing assistant.
The nurse should include which of the following instructions in the teaching plan for a client with chronic sinusitis? 1. Avoid the use of caffeinated beverages. 2. Perform postural drainage every day. 3. Take hot showers twice daily. 4. Report a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius or higher. The correct answer is 3. Take hot showers twice daily. The client with chronic sinusitis should be instructed to take hot showers in the morning and evening to promote drainage of secretions. There is no need to limit caffeine intake. Performing postural drainage will inhibit removal of secretions, not promote it. Clients should elevate the head of the bed to promote drainage. Clients should report all temperatures higher than 100.4 degrees Fahrenheit or 38 degrees Celsius because a temperature that high can indicate infection.
A nurse manager plans to provide feedback to a subordinate who needs a change in behavior. Which is the first intervention by the nurse manager? 1. Be assertive. 2. Explore alternatives. 3. Identify the unacceptable behavior. 4. Document the content of the counseling session. The correct answer is 3. Identify the unacceptable behavior. Rationale. Problem recognition is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. The nurse manager can provide negative feedback that is firm without being assertive. Not yielding under pressure is less confrontational than being confident in a persistent way. When providing negative feedback, the exploration of alternative solutions is performed later in the counseling session. Although documenting the content of the counseling session should be done, it is not feedback. Feedback is necessary for the subordinate to recognize one's offending behavior. In addition, documentation is the last, not the first, step in the counseling process.
The nurse enters a laboring client's room. The client is complaining of intense back pain with each contraction. The nurse concludes that the fetus is likely in which of the following positions? 1. Mentum anterior. 2. Sacrum posterior. 3. Occiput posterior. 4. Scapula anterior. The correct answer is 3. Occiput posterior. A fetus in the mentum anterior position is unlikely to elicit severe back pain in the mother. A fetus in the sacral posterior position is unlikely to elicit severe back pain in the mother. When a fetus is in the occiput posterior position, mothers frequently complain of severe back pain. A fetus in the scapula anterior position is unlikely to elicit severe back pain in the mother. A client with iron deficiency anemia is refusing to take the prescribed oral iron medication because the medication is causing nausea. The nurse should do which of the following? Select all that apply. 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. 3. Tell the client to use stool softeners to minimize constipation. 4. Offer to administer the medication by an intramuscular injection. 5. Suggest that the client take the iron with orange juice. The correct answers are 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. And 5. Suggest that the client take the iron with orange juice. Nausea and vomiting are common adverse effects of oral iron preparations. The nurse should first ask the client why the client does not want to take the oral medication, and then suggest ways to decrease the nausea and vomiting. Ginger may help minimize the nausea, and the client can try this remedy and evaluate its effectiveness. Iron should be taken on an empty stomach, but can be taken with orange juice. The client can evaluate if this helps the nausea. Stool softeners should not be used in clients with iron deficiency anemia. Instead, constipation can be prevented by following a high-fiber diet. Administering iron intramuscularly is done only if other approaches are not effective.
Which activity would be appropriate? To delegate to an unlicensed personnel for a client diagnosed with a myocardial infarction who is stable. 1. Evaluate the lung sounds. 2. Help the client identify risk factors for coronary artery disease. 3. Provide teaching on a 2-gram sodium diet. 4. Record the intake and output. The correct answer is 4. Unlicensed personnel are able to measure and record intake and output. The nurse is responsible for client teaching physical assessments, and evaluating the information collected on the client.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse teaches the client how to instill nose drops. Which of the following techniques is correct? 1. The client uses sterile technique when handling the dropper. 2. The client blows the nose gently before instilling drops. 3. The client uses a new dropper for each installation. 4. The client sits in a semi-Fowler's position with the head tilted forward after administration of the drops. The correct answer is 2. The client blows the nose gently before instilling drops. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position.
A nurse manager is experiencing staff resistance when implementing change. Which is the most important action by the nurse manager to overcome resistance to change? 1. Identify the reason for the resistance. 2. Restate the purpose of the change concisely. 3. Modify the goals to appeal to more key people. 4. Emphasize the positive consequences of the planned change. The correct answer is 1. Identify the reason for the resistance. Rationale. Option 1 is essential to overcome resistance to change. There are many different reasons people resist change. Each person will respond to different strategies. There are 4 different types of interventions to overcome resistance: providing information, disproving currently held beliefs, maintaining psychological safety, and administrating an order or command. Although it is important to state the purpose of the change clearly and concisely, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change. Modifying a goal compromises the integrity of the planned change. All ramifications associated with the change should be explored before beginning, and all contingencies planned for, so that modifying a goal will be unnecessary. Although emphasizing the positive consequences of the planned change might be done, another option is a more important action that can be implemented by the nurse manager to overcome resistance to change.
During a vaginal examination, the nurse palpates fetal buttocks that are facing the left posterior and are 1 centimeter above the ischial spines. Which of the following is consistent with this assessment? 1. LOA -1 station. 2. LSP -1 station. 3. LMP +1 station. 4. LSA +1 station. The correct answer is 2. LSP -1 station. The LOA position refers to a fetus whose occiput is facing toward the mother's left anterior, and a presenting part at -1 station is 1 centimeter above the ischial spines. The LSP position is the correct answer. The fetal buttocks are facing toward the mother's left posterior, and buttocks at -1 station are 1 centimeter above the ischial spines. The LMP position refers to a fetus whose face is facing toward the mother's LP, and a presenting part at +1 is 1 centimeter below the ischial spines. The LSA position refers to a fetus whose buttocks are facing toward the mother's LA, and a presenting part at +1 station is 1 centimeter below the ischial spines. The nurse is assisting with a bone marrow aspiration and biopsy. In which order, from first to last, should the nurse complete the following tasks? 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. 3. Verify the client has signed an informed consent. 4. Apply ice to the biopsy site. The correct order is 3. Verify the client has signed an informed consent. 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. And 4. Apply ice to the biopsy site. First, the nurse must verify that the client has voluntarily signed a consent form before the procedure begins, and check that the client understands the procedure. The nurse then positions the client in a side-lying or lateral decubitus, position with the affected side up. Then the nurse should clean the skin site and surrounding area with an antiseptic solution, such as betadine, before the healthcare provider numbs the site and collects the specimen. When the procedure is finished, the nurse must apply ice to the biopsy site to reduce pain.
The nurse is caring for a client whose condition has been deteriorating. The client becomes unresponsive. The blood pressure is 80/40, and oxygen saturation is 90% on 50% face mask. The nurse should 1. Begin chest compressions. 2. Call the rapid response team. 3. Remove the family from the room. 4. Ventilate the client with a bag mask device. The correct answer is 2. The rapid response team should be called immediately to evaluate and treat the client. There is no indication at this time for manual ventilations or chest compressions. If the family is not interfering in client care, it can be reassuring to the family to see that all possible care is being provided. The nurse is preparing to teach a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. 4. Expect a few bumps and bruises when you go home. 5. Rest when you are tired. 6. Avoid consuming 3 or more alcoholic drinks per day. The correct answers are 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. And 5. Rest when you are tired. Rationale. The purpose of this teaching is to help the patient prevent falls. The hip protector can prevent hip fractures if the patient falls. Throw rugs and obstacles in the home increase the risk of falls. Patients who are tired are also more likely to fall. Exercise helps to strengthen muscles and improve coordination. Women should not consume more than 1 drink per day, and men should not consume more than 2 drinks per day.
The nurse is obtaining the pulse of a client who had a femoral popliteal bypass surgery 6 hours ago. Which assessment provides the most accurate information about the client's post-operative status? 1, 2, 3, 4. The correct answer is option 4. The presence of a strong dorsalis pedis pulse indicates that there is circulation to the extremity distal to the surgery, indicating that the graft between the femoral and popliteal artery is allowing blood to circulate effectively. Option 1 shows the nurse obtaining the radial pulse. Option 2 shows the femoral pulse, which is proximal to the surgery site and will not indicate circulation distal to the surgery site. Option 3 shows the nurse obtaining an apical pulse.
A client with depression who is taking doxepin, sinequin, 100 milligrams PO, at bedtime has dizziness on arising. Which of the following suggestions is most appropriate? 1. Try taking a hot shower. 2. Get up slowly and dangle your feet before standing. 3. Stay in bed until you are feeling better. 4. You need to limit the fluids you drink. The correct answer is 2. Get up slowly and dangle your feet before standing. Rationale. Doxepin and other tricyclic antidepressants may cause postural hypotension, especially in the morning. Postural hypotension occurs because the tricyclic antidepressant inhibits the body's natural vasoconstrictive reaction when a person stands. The nurse regularly monitors the client's vital signs, both lying and standing. The nurse should instruct the client to rise slowly and dangle his feet before standing. Advising the client to take a hot shower is detrimental to the client's safety. Heat causes vasodilation, which could further exacerbate the dizziness, placing the client at risk for falls and subsequent injury. Telling the client to stay in bed until he is feeling better is not helpful and is impractical. The client with depression would rather stay in bed and withdraw from others. Placing the client on fluid restriction is detrimental to the client with depression whose fluid and food intake may be inadequate.
When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? 1. Document the patient's refusal to take the medication. 2. Discuss with a family member the need for the patient to take the medication. 3. Explain again to the patient the consequences of refusing to take the medication. 4. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is 1. Document the patient's refusal to take the medication. Withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time.
The nurse is preparing to administer the last dose of ceftriaxone before discharge to a 1-year-old, but finds the IV has occluded. The nurse should 1. Restart the IV. 2. Administer the medication intramuscularly. 3. Arrange for early discharge. 4. Contact the prescriber to request a prescription change. The correct answer is 4. Restarting an IV for 1 dose of a medication may not be in the infant's best interest when the medication can be given in an alternate form. The prescriber should be contacted to determine IM or PO options. Rocephin may be given IM, but changing the route of medication administration requires a prescription. Failing to complete an entire course of antibiotics contributes to the emergence of antibiotic resistance and would rarely be the best option.
A nurse is caring for a hospitalized 22-year-old female client with type 1 diabetes mellitus and toxic shock syndrome. Which of the following should the nurse perform first? 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. 2. Administer 50 milligrams of meperidine IM every 4 hours as needed for pain. 3. Teach the client to use pads at night instead of tampons during her menstrual period. 4. Administer 400 milligrams of ciprofloxacin IV every 12 hours infused over 1 hour. The correct answer is 1. Administer 5% dextrose in half-normal saline solution at 150 milliliters per hour IV. Fluid losses can occur from vomiting, diarrhea, and fever and can lead to hypovolemic shock. The first nursing action is to treat the hypovolemic shock that accompanies toxic shock, so the IV fluids must be administered immediately. The fluid replacement is critical to avoid circulatory collapse. Pain medication and teaching can be implemented later. Antibiotics will be given because toxic shock syndrome is caused by a staphylococcal infection. However, fluid replacement is initiated first to treat life-threatening hypovolemic shock. The nurse is assigned to care for a client with a detached retina. Which findings should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. The client diagnosed with a full thickness burn over 38% of the body is admitted to the burn unit 4 hours after the fire. The HCP writes an order for Ringer's lactate 450 milliliter per hour. Which interventions should the nurse implement? Select all that apply. 1. Question the HCP's orders. 2. Administer the IV fluid as prescribed. 3. Infuse the IV fluid via a pump. 4. Do not administer more than 200 milliliter an hour. 5. Verify the order with another nurse in the burn unit. The correct answers are 2. Administer the IV fluid as prescribed, and 3. Infuse the IV fluid via a pump. There are formulas that are used to determine the client's fluid volume resuscitation. The formulas specify the total amount of fluid that must be infused in 24 hours, 50% in the first 8 hours, followed by the other 50% over the next 16 hours. This is a large amount of fluid, but its administration is not uncommon in clients diagnosed with full thickness, burns over more than 20% of their total body surface. The IV fluids must be infused on a pump to ensure the client receives the correct amount for fluid resuscitation. For option 1, the nurse should administer this IV fluid as ordered. For option 4, this is not an unusual amount of fluid to be infused. There is no absolute amount of fluid that a client may require during fluid resuscitation. For option 5, there is no reason to verify this order with another nurse in the burn unit. The parent of a 4-month-old with cystic fibrosis asks the nurse what time to begin the child's first chest physiotherapy each day. Which is the nurse's best response? 1. 30 minutes before feeding the child breakfast. 2. After deep suctioning the child each morning. 3. 30 minutes after feeding the child breakfast. 4. Only when the child has congestion or coughing. The correct answer is 1. 30 minutes before feeding the child breakfast. CPT should be done in the morning prior to feeding to avoid the risk of the child vomiting.
A charge nurse is making assignments for a group of children on a pediatric unit. The nurse should most avoid assigning the same nurse to care for a 2-year-old with respiratory syncytial virus and 1. An 18-month-old with RSV. 2. A 9-year-old 8 hours post-appendectomy. 3. A 1-year-old with a heart defect. 4. A 6-year-old with sickle cell crisis. The correct answer is 3. RSV may be spread through both direct and indirect contact. While contact and standard precautions should be employed, a measure to further decrease the risk of nosocomial infections is to avoid assigning the same nurse caring for an RSV client to a client at risk for infection. A private room is preferred, but if this is not an option, the nurse should understand that children 2 years of age and younger are most at risk for RSV, especially if they have other chronic problems, such as a heart defect. From an infection control perspective, pairing 2 clients with RSV is ideal. RSV infections are less likely to pose a serious problem in older children.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is asking for information about using an intrauterine device. Which of the following questions asked by the nurse would provide pertinent information on whether or not a client is a candidate for an IUD? 1. Do you smoke? 2. Do you have hypertension? 3. How often do you have sex? 4. Are you in a monogamous relationship? The correct answer is 4. Are you in a monogamous relationship? Due to the increased risk of pelvic inflammatory disease, candidates for the IUD should be in a monogamous relationship. Smoking and hypertension are not contraindications for an IUD. The frequency of sexual relations will not affect IUD use. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. The nurse is discussing the application of silver nitrate to a client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this medication after discharge? 1. Administer the silver nitrate ointment directly to the burned area twice a day. 2. Notify the HCP if a black discoloration occurs on the burned area. 3. Apply the silver nitrate solution to the wound dressing every 2 hours. 4. Do not allow anyone except the HCP to change the wound dressing. The correct answer is 3. Apply the silver nitrate solution to the wound dressing every 2 hours. Silver nitrate is a topical antimicrobial. Silver nitrate is used as a 0.5% solution in distilled water and should be applied to the bulky gauze dressing every 2 hours, and the dressing should be changed twice a day. Option 1 is the incorrect way to apply silver nitrate. Silver nitrate solution causes a black discoloration on all skin surfaces and dressings with which it comes into contact. Therefore, the client would not need to notify the HCP. The bulky wound dressing must be changed twice a day. Therefore, the nurse must teach the client to change the dressing. A dressing change does not have to be done only by the HCP. Which would the nurse explain to parents about the inheritance of cystic fibrosis? 1. CF is an autosomal dominant trait passed on from the child's mother. 2. CF is an autosomal dominant trait passed on from the child's father. 3. The child of parents who are both carriers of the gene for CF has a 50% chance of acquiring CF. 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. The correct answer is 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. If the child is born to a parent with CF and the other parent is a carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease.
A teaching care plan to prevent the transmission of respiratory syncytial virus should include which of the following? Select all that apply. 1. The virus can be spread by direct contact. 2. The virus can be spread by indirect contact. 3. Palivizumab is recommended to prevent RSV for all toddlers in daycare. 4. The virus is typically contagious for 3 weeks. 5. Older children seldom spread RSV. 6. Frequent hand washing helps reduce the spread of RSV. The correct answers are 1, 2, and 6. RSV can be spread through direct contact, such as kissing the face of an infected person, and it can be spread through indirect contact by touching surfaces covered with infected secretions. Hand washing is one of the best ways to reduce the risk of disease transmission. Palivizumab can prevent severe RSV infections, but is only recommended for the most at-risk infants and children. RSV is typically contagious for 3 to 8 days. RSV frequently manifests in older children as cold-like symptoms. Infected school-age children frequently spread the virus to other family members.
A client taking oral contraceptives is placed on a 10-day course of antibiotics for an infection. Which of the following instructions should the nurse include in the teaching plan? 1. Use a barrier method of birth control for the rest of your cycle. 2. You should stop taking the oral contraceptives while taking the antibiotic. 3. Call your healthcare provider for increased hunger or fluid retention. 4. Take the antibiotics 2 hours after the oral contraceptive. The correct answer is 1. Use a barrier method of birth control for the rest of your cycle. Antibiotics may decrease the effectiveness of oral contraceptives. The client should be instructed to continue the contraceptives and use a barrier method as a backup method of birth control until the next menstrual cycle. The client should not stop taking her oral contraceptives, and there is no indication for or benefit to taking the antibiotic 2 hours after the contraceptive. There is no incidence of the adverse effects of increased hunger and fluid retention with the interaction of antibiotic therapy and oral contraceptives. For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. The client diagnosed with a partial thickness burn is prescribed mafenide acetate. Which intervention should the emergency department nurse implement when applying this medication? 1. Do not administer if the serum sodium level is decreased. 2. Assess the client's urine for any increased concentration. 3. Determine the amount of burned skin using the rule of 9. 4. Pre-medicate the client prior to administering the medication. The correct answer is 4. Pre-medicate the client prior to administering the medication. Mafenide acetate is a topical antimicrobial. The medication causes pain or a burning sensation following its application. Therefore, the client should be pre-medicated. The serum sodium level is not affected by mafenide acetate, a topical antimicrobial. It is affected when administering silver nitrate, a topical antimicrobial that is also used to treat burns. Urine concentration may be affected by silver sulfadiazine, a topical antimicrobial that is used to treat burns, but mafenide acetate does not affect urine concentration. This should have been done prior to the emergency department's physician prescribing this medication. Therefore, this would not be an appropriate intervention. How does the nurse interpret the laboratory analysis of a stool sample containing excessive amounts of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is 1. Not compliant with taking her vitamins. 2. Not compliant with taking her enzymes. 3. Eating too many foods high in fat. 4. Eating too many foods high in fiber. The correct answer is 2. Not compliant with taking her enzymes. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers.
The nurse observes an 18-month-old who has been admitted with a respiratory tract infection. See the figure below. The nurse should first 1. Position the child supine. 2. Call the rapid response team. 3. Offer the child a carbonated drink. 4. Place the child in a croup tent. The correct answer is 4. The child is in respiratory distress and is sitting in a position to relieve the airway obstruction. The nurse should provide a humidified environment with a croup tent with cool mist to facilitate breathing and liquefy secretions. The child should remain sitting to facilitate breathing. The nurse should allow the child to determine the most comfortable position. After the child is breathing normally, the nurse can offer fluids. The primary care provider also may prescribe intravenous fluids. The nurse can call the rapid response team if the respiratory distress is not relieved by using a croup tent or changes in other vital signs indicate further distress.
A female client with which condition would be at increased risk for vulvovaginal candidiasis? Select all that apply. 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. 3. Human immunodeficiency virus infection. 4. Hypertension. 5. Asthma. The correct answers are 1. Uncontrolled diabetes. 2. Immunosuppression due to cancer. And 3. Human immunodeficiency virus infection. Women with underlying medical conditions, such as uncontrolled diabetes and HIV infection or cancer-causing immunosuppression, correlate with an increasing severity of candidiasis. Hypertension and asthma are not related to immunosuppression or complicated candidiasis. After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. At 9 o'clock, the charge nurse observes the primary nurse crushing an enteric-coated aspirin in the medication room. Which action should the charge nurse implement? 1. Take no action because this is an acceptable standard of practice. 2. Correct the primary nurse's behavior in the medication room. 3. Explain that enteric-coated medication should not be crushed. 4. Complete an adverse occurrence report on the primary nurse. The correct answer is 3. Explain that enteric-coated medication should not be crushed. The charge nurse should explain to the primary nurse that enteric-coated aspirin should not be crushed because the coating ensures the aspirin will dissolve only in the small intestine where the coating dissolves. The aspirin will be absorbed in the stomach if the coating is crushed. Enteric-coated aspirin should not be crushed. The charge nurse should not correct the primary nurse in front of other staff, and at 9 o'clock, there would be other nurses in the medication room. Because the client did not receive the crushed enteric-coated aspirin, no adverse occurrence report needs to be completed. This form is completed if the client's condition has been compromised in some way. When assessing the psychological adjustment of an 8-week gravida, which of the following would the nurse expect to see signs of? 1. Ambivalence. 2. Depression. 3. Anxiety. 4. Ecstasy. The correct answer is 1. Ambivalence. It is common for women to be ambivalent about their pregnancy during the first trimester. Even women who stop taking birth control pills to become pregnant are often startled and ambivalent when they actually get pregnant. This is not pathological. The women usually slowly accept the pregnancy, and by 20 weeks gestation are happy and enthusiastic about the prospect of becoming a mother.
In preparation for discharge, the nurse teaches a mother of an infant diagnosed with bronchiolitis about the condition and its treatment. Which of the following statements by the mother indicates successful teaching? 1. I need be sure to take my child's temperature every day. 2. I hope I don't get a cold from my child. 3. Next time my child gets a cold, I need to listen to the chest. 4. I need to wash my hands more often. The correct answer is 4. Hand washing is the best way to prevent respiratory illnesses and the spread of disease. Bronchiolitis, a viral infection primarily affecting the bronchioles, causes swelling and mucus accumulation of the lumina and subsequent hyperinflation of the lung with air trapping. It is transmitted primarily by direct contact with respiratory secretions as a result of eye-to-hand or nose-to-hand contact, or from contaminated fomites. Therefore, hand washing minimizes the risk for transmission. Taking the child's temperature is not appropriate in most cases, as long as the child is getting better. Taking the temperature will not be helpful. The mother's statement that she hopes she doesn't get a cold from her child does not indicate understanding of what to do after discharge. For most parents, listening to the child's chest would not be helpful because the parents would not know what they were listening for. Rather, watching for an increased respiratory rate, fever, or evidence of poor eating or drinking would be more helpful in alerting the parent to potential illness.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is assessing a client with vaginal discharge. Which of the following diseases are commonly associated with vaginal discharge? Select all that apply. 1. Candidiasis. 2. Bacterial vaginosis. 3. Gonorrhea. 4. Trichomoniasis. 5. Syphilis. The correct answers are 1. Candidiasis, 2. Bacterial vaginosis, and 4. Trichomoniasis. Candidiasis causes a white discharge that results in redness and itching. Bacterial vaginosis causes a thick, white, adherent discharge. Trichomoniasis causes a diffuse yellow-green discharge and is a sexually transmitted infection. Gonorrhea and syphilis usually do not change vaginal discharge. A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. The client is taking acetyl-salicylic acid 4 to 5 times a day for severe osteoarthritic pain. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl-salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl-salicylic acid. 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. 5. Explain that ringing in the ears is a common side effect. The correct answers are 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl-salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl-salicylic acid. And 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. Alcohol displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should instruct the client not to drink alcohol. Acetyl-salicylic acid poisoning can kill children, and all medications, prescription or non-prescription, should be kept out of the reach of children. High doses of acetyl-salicylic acid can cause bleeding. Therefore, the dentist should be made aware of the client's medication use. Aspirin toxicity can occur when the client is taking acetyl-salicylic acid 4 to 5 times a day. Therefore, the serum level should be kept within normal limits. Mild toxicity occurs with serum levels above 30 milligrams per deciliter, and severe toxicity occurs above 50 milligrams per deciliter. Tinnitus is a sign of aspirin toxicity and should be reported to the HCP. The midwife has just palpated the fundal height at the location noted on the picture below. It is likely that the client is how many weeks pregnant? 1. 12 weeks. 2. 20 weeks. 3. 28 weeks. 4. 36 weeks. The correct answer is 1. 12 weeks. The client is likely 12 weeks pregnant. At 12 weeks, the fundal height is at the top of the symphysis. The fundal height is assessed at every prenatal visit. It is an easy, non-invasive means of assessing fetal growth. The nurse should know that the top of the fundus is at the level of the symphysis at the end of the first trimester.
An infant is being treated at home for bronchiolitis. Which of the following should the nurse teach the parent about home care? Select all that apply. 1. Offering small amounts of fluids frequently. 2. Allowing the infant to sleep prone. 3. Calling the clinic if the infant vomits. 4. Writing down how much the infant drinks. 5. Performing chest physiotherapy every 4 hours. 6. Watching for difficulty breathing. The correct answers are 1 and 6. An infant with bronchiolitis will have increased respirations and will tire more quickly, so it is best and easiest for the infant to take fluids more often in smaller amounts. The parents also would be instructed to watch for signs of increased difficulty breathing, which signal possible complications. Healthy infants, and even those with bronchiolitis, should sleep in the supine position. Calling the clinic for an episode of vomiting would not be necessary. However, the parents would be instructed to call If the infant cannot keep down any fluids for a period of more than 4 hours, parents would not need to record how much the infant drinks. Chest physiotherapy is not indicated because it does not help and further irritates the infant.
A client is prescribed oral metronidazole for treatment of bacterial vaginosis. What should the nurse instruct the client to avoid during treatment and for 24 hours thereafter? 1. Douching. 2. Sexual intercourse. 3. Hot tub baths. 4. Alcohol consumption. The correct answer is 4. Alcohol consumption. Metronidazole interacts with alcohol and can cause a serious disulfiram-type reaction with severe, prolonged vomiting. The client should not douche unless following a medical prescription, but douching does not interact with metronidazole. Sexual intercourse and hot tub baths are not known to affect the incidence or treatment of bacterial vaginosis. Which finding should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? 1. Ibuprofen to a client receiving furosemide. 2. Nabumetone to a client receiving digoxin. 3. Acetyl-salicylic acid to a client receiving warfarin. 4. Ketorolac intramuscularly to a client on morphine. The correct answer is 3. Acetyl-salicylic acid to a client receiving warfarin. Acetyl-salicylic acid is a mild analgesic, but it is also an antiplatelet. Acetyl-salicylic acid displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should question administering the acetyl-salicylic acid. Ibuprofen is an NSAID. NSAIDs do not interfere with the effectiveness of loop diuretics. Therefore, the nurse would not question administering the ibuprofen. Nabumetone is a cyclooxygenase 2 inhibitor. Cyclooxygenase 2 inhibitors do not interfere with the effectiveness of cardiac glycosides. Therefore, the nurse would not question administering the nabumetone. Ketorolac is an NSAIDs. Ketorolac is often administered around the clock to a client in pain, along with a narcotic analgesic. Ketorolac decreases the inflammation to help decrease the pain. A client is in the 10th week of her pregnancy. Which of the following symptoms would the nurse expect the client to exhibit? Select all that apply. 1. Backache. 2. Urinary frequency. 3. Dyspnea on exertion. 4. Fatigue. 5. Diarrhea. The correct answers are 2. Urinary frequency, and 4. Fatigue. During the first trimester, the body undergoes a number of important changes. The embryo is developing, the hormones of the body are increasing, and the maternal blood supply is increasing. To accomplish each of the tasks, the body uses energy. The mother is fatigued not only because the body is undergoing great change, but also because the thyroid gland has not caught up with the increasing energy demands. In addition, because the organs are confined within the bony pelvis, the enlarging uterus prevents the bladder from expanding with large quantities of urine. As a result, the woman needs to urinate much more frequently than she did prior to becoming pregnant.
While the nurse is working in a homeless shelter, assessment of a 6-month-old infant reveals a respiratory rate of 52 breaths per minute retractions and wheezing. The mother states that her infant was doing fine until yesterday. Which of the following actions would be most appropriate? 1. Administer a nebulizer treatment. 2. Send the infant for a chest radiograph. 3. Refer the infant to the emergency department. 4. Provide teaching about cold care to the mother. The correct answer is 3. Based on the assessment findings of increased respiratory rate, retractions, and wheezing, this infant needs further evaluation. which could be obtained in an emergency department. Without a definitive diagnosis, administering a nebulizer treatment would be outside the nurse's scope of practice unless there was a prescription for such a treatment. Sending the infant for a radiograph may not be in the nurse's scope of practice. The findings need to be reported to a primary care provider who can then determine whether or not a chest radiograph is warranted. The infant is exhibiting signs and symptoms of respiratory distress and is too ill to send out with just instructions on cold care for the mother.
A nurse is discussing daily activities with a client. Which of the following activities puts the client at risk for altering the normal pH of her vagina? 1. Consuming over 4 cups of coffee per day. 2. Having sexual intercourse during the menstrual cycle. 3. Douching unless instructed to do so by the healthcare provider. 4. Using tampons during the menstrual cycle. The correct answer is 3. Douching unless instructed to do so by the healthcare provider. Douching may disrupt the normal flora of the vaginal lactobacilli and change the pH, which could result in overgrowth of other bacteria. Coffee, intercourse during menses, and tampons are not related to changes in vaginal pH or the incidence of bacterial vaginosis. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. The client diagnosed with severe osteoarthritis of the left knee is receiving sodium hyaluronate injected directly into the left knee. Which information should be discussed with the client? 1. Explain that this medication will cause some bleeding into the joint. 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. 3. Discuss that the medication will be injected daily for 7 days. 4. Tell the client that strict bed rest is required for 24 hours after the injection. The correct answer is 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. Sodium hyaluronate is a synovial joint lubricant used for relief of osteoarthritis pain, unrelieved by NSAIDs. After the injection, the client can walk and perform routine daily activities, but running, bicycling, or strenuous activity should be avoided. Sodium hyaluronate is a preparation of a chemical normally found in high amounts in the synovial fluid. The injection replaces or supplements the body's natural hyaluronic acid that deteriorates as a result of the inflammation of osteoarthritis. Any bleeding into the joint is a complication. Bleeding into a joint would not be the expected benefit of any type of medication. The treatment includes 3 to 5 injections, with the client receiving 1 injection every week. This injection is done in an HCP's office. The client will be able to walk out of the clinic after the injection. A 20-year-old client states that the at-home pregnancy test that she took this morning was positive. Which of the following comments by the nurse is appropriate at this time? 1. Congratulations, you and your family must be so happy. 2. Have you told the baby's father yet? 3. How do you feel about the results? 4. Please tell me when your last menstrual period was. The correct answer is 3. How do you feel about the results? Some pregnant women are happy about their pregnancy, some are sad, and still others are frightened. At the initial interview, it is essential that the nurse not assume that the woman will respond in any particular way. The nurse must ask open-ended questions to elicit the woman's feelings about the pregnancy.
A father brings his 3-month-old infant to the clinic, reporting that the infant has a cold, is having trouble breathing, and just doesn't seem to be acting right. Which of the following actions should the nurse do first? 1. Check the infant's heart rate. 2. Weigh the infant. 3. Assess the infant's oxygen saturation. 4. Obtain more information from the father. The correct answer is 3. In an infant with these symptoms, the first action by the nurse would be to obtain an oxygen saturation reading to determine how well the infant is oxygenating, which is valuable information for an infant having trouble breathing. Because the father probably could provide no other information, checking the heart rate would be the second action done by the nurse. Then the nurse would obtain the infant's weight.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is reviewing a client's chart and notes the Papa-Nicolau smear laboratory report indicates visualization of clue cells and a vaginal pH of 3.8. What should the nurse teach this client? Select all that apply. 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. 3. All vaginal infections are sexually transmitted infections. 4. Do not douche unless instructed by a healthcare provider. 5. Usually vaginal infections can be treated with over-the-counter preparations. The correct answers are 1. Seek care if the vaginal discharge has a fishy odor. 2. Seek care if experiencing thick, white, adherent vaginal discharge. And 4. Do not douche unless instructed by a healthcare provider. Bacterial vaginosis is a clinical syndrome resulting from the replacement of the normal vaginal lactobacillus species with overgrowth of anaerobic bacteria that cause a cluster of symptoms. Presence of a thick, white, adherent vaginal discharge with a fishy odor is evidence for bacterial vaginosis, and the client should seek treatment. The client should not douche unless under medical prescriptions, because douching can cause bacteria to ascend into the uterus. Bacterial vaginosis is not sexually transmitted, and it does not require treatment of the partner. Vaginal infections commonly require an examination and diagnostic assessment. A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. The client diagnosed with osteoarthritis is prescribed celecoxib. Which statement by the client warrants intervention by the nurse? 1. I take aspirin daily to help prevent heart disease. 2. I am allergic to penicillin and aminoglycosides. 3. I know I am overweight and need to lose 50 pounds. 4. I walk 30 minutes at least 3 times a week. The correct answer is 1. I take aspirin daily to help prevent heart disease. Celecoxib is an NSAID. The client should not take aspirin with an NSAID because it can increase the risk of gastrointestinal upset and possible gastrointestinal bleeding. Allergies to antibiotics are not a contraindication to the use of NSAID. Obesity is not contraindicated in clients taking NSAIDs. Exercising is recommended for clients with osteoarthritis unless it causes pain. Therefore, this activity would not warrant the client not taking celecoxib. A 16-year-old G1P0000 is being seen at her 10-week gestation visit. She tells the nurse that she felt the baby move that morning. Which of the following responses by the nurse is appropriate? 1. That is very exciting. The baby must be very healthy. 2. Would you please describe what you felt for me? 3. That is impossible. The baby is not big enough yet. 4. Would you please let me see if I can feel the baby? The correct answer is 2. Would you please describe what you felt for me? Quickening, or subjective fetal movement, occurs between 16 and 20 weeks gestation. At 10 weeks gestation, it would be impossible for the young woman to feel fetal movement. The nurse, therefore, should elicit more information from the teen to determine what she had felt.
A child has viral pharyngitis. The nurse should advise the parents to do which of the following? Select all that apply. 1. Use a cool mist vaporizer. 2. Offer a soft to liquid diet. 3. Administer amoxicillin. 4. Administer acetaminophen. 5. Place the child on secretion precautions. The correct answers are 1, 2, and 4. Viral pharyngitis is treated with symptomatic supportive therapy. Treatment includes use of a cool mist vaporizer, feeding a soft or liquid diet, and administration of acetaminophen for comfort. Viral infections do not respond to antibiotic administration. The child does not need to be on secretion precautions because viral pharyngitis is not contagious.
A nurse is planning care for a client who underwent a percutaneous needle biopsy of the kidney. What should the nurse plan to do immediately after the biopsy? Select all that apply. 1. Assess the biopsy site. 2. Take vital signs every hour. 3. Assess urine for hematuria. 4. Place the client in a prone position. 5. Assess the client for chest pain. The correct answers are 1. Assess the biopsy site. 3. Assess urine for hematuria. And 4. Place the client in a prone position. The nurse should assess the biopsy site for bleeding and hematoma formation. The client should remain prone for 8 to 24 hours after the biopsy. A pressure dressing will aid in blood coagulation. Vital signs assessment should be taken every 5 to 15 minutes for the first hour, and then less often if the client is stable. The urine does not need to be collected and kept on ice. The nurse should collect serial urine specimens to assess for hematuria. A renal biopsy does not put the client at increased risk for chest pain. The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition. The client is admitted with severe low back pain and prescribed methocarbamol IV piggyback every 8 hours. Which nursing intervention has priority when administering this medication? 1. Ask the client to lie flat for 15 minutes following the IV infusion. 2. Infuse at a rapid rate of 200 to 250 milliliter per hour via an infusion pump. 3. Assess the IV site for extravasation after the infusion is complete. 4. Monitor liver function laboratory tests daily. The correct answer is 1. Ask the client to lie flat for 15 minutes following the IV infusion. Methocarbamol is a muscle relaxant. The client should be kept recumbent during and for at least 15 minutes following the administration of methocarbamol IV to reduce the risk of orthostatic hypotension. The medication must be administered slowly at a rate of no greater than 300 milligrams per minute, not by rapid infusion. The IV site should be assessed prior to the initiation of the medication to prevent complications from extravasation of the medication into the tissues. Methocarbamol is detoxified by the kidneys, not the liver. A client enters the prenatal clinic. She states that she believes she is pregnant. Which of the following hormone elevations will indicate a high probability that the client is pregnant? 1. Chorionic gonadotropin. 2. Oxytocin. 3. Prolactin. 4. Luteinizing hormone. The correct answer is 1. Chorionic gonadotropin. Human chorionic gonadotropin is produced by the fertilized egg. Its presence in the bloodstream signals the body to keep the corpus luteum alive. Until the placenta takes over the function of producing progesterone and estrogen, the corpus luteum produces the hormones that are essential to the maintenance of the pregnancy. Oxytocin is the hormone of labor. It is not measured as a sign of pregnancy. Prolactin is the hormone that stimulates lactogenesis immediately after delivery. It is not measured as a sign of pregnancy. Luteinizing hormone is the hormone that stimulates ovulation. It is not measured as a sign of pregnancy.
A 21-month-old child admitted with a diagnosis of croup now has a respiratory rate of 48 breaths per minute, a heart rate of 120 beats per minute, and a temperature of 100.8 degrees Fahrenheit rectally. The nurse is having difficulty calming the child. Which of the following should the nurse do next? 1. Administer acetaminophen. 2. Notify the primary care provider immediately. 3. Allow the toddler to continue to cry. 4. Offer clear fluids every few minutes. The correct answer is 2. The nurse may be having difficulty calming the child because the child is experiencing increasing respiratory distress. The normal respiratory rate for a 21-month-old is 25 to 30 breaths per minute. The child's respiratory rate is 48 breaths per minute. Therefore, the primary care provider needs to be notified immediately. Typically, acetaminophen is not given to a child unless the temperature is 101 degrees Fahrenheit or higher. Letting the toddler cry is inappropriate with croup because crying increases respiratory distress. Offering fluids every few minutes to a toddler experiencing increasing respiratory distress would do little, if anything, to calm the child. Also, the child would have difficulty coordinating breathing and swallowing, possibly increasing the risk of aspiration.
A client is scheduled to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. Which of the following indicates that the client understands how to manage the urine as a biohazard? The client will 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. 3. Clean the bathroom daily with disinfectant wipes. 4. Use a separate bathroom from the rest of the family for the next 8 weeks. The correct answer is 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. After intravesical chemotherapy, the client must treat the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours following a treatment. It is not necessary to use a bedpan and then empty the urine in the toilet. The client can use the toilet, but must disinfect the urine with bleach. The bathroom does not need to be cleaned daily with disinfectant wipes. The client does not need to use a separate bathroom as long as the client's urine is disinfected with bleach. According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. The nurse is administering 9 o'clock medications to clients on a medical unit. Which medication should be administered first? 1. Morphine sulfate extended release to a client with low back pain. 2. Chlorzoxazone to a client on bed rest. 3. Acetaminophen to a client with a headache. 4. Diazepam to a client with muscle spasms. The correct answer is 4. Diazepam to a client with muscle spasms. Diazepam is a benzodiazepine. A client having muscle spasms is a priority for the nurse. Muscle spasms can be extremely painful. This medication should be administered first. Morphine sulfate extended release is an opioid analgesic and is a sustained-release tablet. This medication is to provide relief of chronic pain over the course of the day. It does not need to be the first medication administered. Chlorzoxazone is a muscle relaxant. The client-prescribed bed rest usually takes a muscle relaxant as a routine medication. It does not need to be administered first. Acetaminophen is an analgesic. A headache that is to be treated with acetaminophen would not be the first medication for the nurse to administer. A client asks the nurse what was meant when the physician told her she had a positive Chadwick sign. Which of the following information about the finding would be appropriate for the nurse to convey at this time? 1. It is a purplish stretch mark on your abdomen. 2. It means that you are having heart palpitations. 3. It is a bluish coloration of your cervix and vagina. 4. It means the doctor heard abnormal sounds when you breathed in. The correct answer is 3. It is a bluish coloration of your cervix and vagina. Chadwick sign is a probable sign of pregnancy. The bluish coloration is a result of the increase in vascularization of the area in response to the high levels of circulating estrogen in the pregnant woman's system.
The father of a 16-month-old child calls the clinic because the child has a low-grade fever, cold symptoms, and a hoarse cough. Which of the following should the nurse suggest that the father do? 1. Offer extra fluids frequently. 2. Bring the child to the clinic immediately. 3. Count the child's respiratory rate. 4. Use a hot air vaporizer. The correct answer is 1. The toddler is exhibiting cold symptoms. A hoarse cough may be part of the upper respiratory tract infection. The best suggestion is to have the father offer the child additional fluids at frequent intervals to help keep secretions loose and membranes moist. There is no evidence presented to suggest that the child needs to be brought to the clinic immediately. Although having the father count the child's respiratory rate may provide some additional information, it may lead the father to suspect that something is seriously wrong, possibly leading to undue anxiety. A hot air vaporizer is not recommended. However, a cool mist vaporizer would cause vasoconstriction of the respiratory passages, making it easier for the child to breathe and loosening secretions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse evaluates the effectiveness of the client's post-operative plan of care. Which of the following would be an expected outcome for a client with an ileal conduit? 1. The client verbalizes the understanding that physical activity must be curtailed. 2. The client will place an aspirin in the drainage pouch to help control odor. 3. The client demonstrates how to catheterize the stoma. 4. The client will empty the drainage pouch frequently throughout the day. The correct answer is 4. The client will empty the drainage pouch frequently throughout the day. It is important that the client empty the drainage pouch throughout the day to decrease the risk of leakage. The client does not normally need to curtail physical activity. Aspirin should never be placed in a pouch because aspirin can irritate or ulcerate the stoma. The client does not catheterize an ileal conduit stoma. The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications. The client diagnosed with chronic low back pain has been taking baclofen. Which instruction should the nurse review with the client? 1. The medication can cause gastric ulcer formation. 2. The client may consume no more than 1 glass of wine per day. 3. The medication must be tapered off when discontinued. 4. The client should not take the medication before bedtime. The correct answer is 3. The medication must be tapered off when discontinued. Baclofen must be tapered off when being discontinued. Abrupt withdrawal after prolonged use can cause anxiety, agitated behavior, hallucinations, severe tachycardia, acute spasticity, and seizures. This medication is not known to increase the risk of ulcers. The client should be warned not to consume any alcohol while taking baclofen. Baclofen is a central nervous system depressant, as is alcohol. The combination of alcohol and baclofen could intensify the depressant effects. The medication can cause drowsiness, which might assist the client to rest. Administration at bedtime is preferred if this is the case. The nurse plans to provide anticipatory guidance to a 10 weeks pregnant client who is being seen in the prenatal clinic. Which of the following information should be a priority for the nurse to provide? 1. Pain management during labor. 2. Methods to relieve backaches. 3. Breastfeeding positions. 4. Characteristics of the newborn. The correct answer is 2. Methods to relieve backaches. This 10-week pregnant client will be entering the second trimester in a couple of weeks. As the uterine body grows, the client is likely to experience backaches. It is appropriate for the nurse to provide information about this possibility and ways to relieve them.
A 3-year-old is brought into the emergency department in her mother's arms. The child's mouth is open and she is drooling and lethargic. Her mother states that she became ill suddenly within the past 2 hours. What should the nurse do first? 1. Draw blood cultures for a complete blood count. 2. Start an intravenous line. 3. Inspect the child's throat with a tongue blade. 4. Maintain the child in an undisturbed upright position. The correct answer is 4. This child is in severe respiratory distress with potential for complete airway obstruction. The nurse should refrain from disturbing the child at this time to avoid irritating the epiglottis and causing it to completely obstruct the child's airway. The child may be intubated or undergo a tracheotomy. However, initially, the child should be kept as calm as possible with as little disruption as possible. Any attempt to restrain the child, draw blood, insert an IV, or examine her throat could result in total airway obstruction.
The nurse is teaching the client with an ileal conduit how to prevent a urinary tract infection. Which of the following measures would be most effective? 1. Avoid people with respiratory tract infections. 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. 3. Use sterile technique to change the appliance. 4. Irrigate the stoma daily. The correct answer is 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. Maintaining a fluid intake of 2,000 to 3,000 milliliters per day is likely to be most effective in preventing urinary tract infection. A high fluid intake results in high urine output, which prevents urinary stasis and bacterial growth. Avoiding people with respiratory tract infections will not prevent urinary tract infections. Clean, not sterile, technique is used to change the appliance. An ileal conduit stoma is not irrigated. The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended. The client presents to the outpatient clinic reporting back pain. Which assessment question should the nurse ask first? 1. What activity did you do to hurt your back? 2. Which over-the-counter medications have you taken? 3. Have you used illegal drugs to treat the back pain? 4. Did you miss any work time because of this pain? The correct answer is 2. Which over-the-counter medications have you taken? The priority at this time is to determine what medications have been tried in order to assess the full extent of the injury. This is the first intervention. Adult clients will frequently only seek the HCP's advice and treatment when remedies have failed. Option 1 is important, but it is not a priority during the initial assessment. The nurse should determine how the client has been treating the injury. This would be the second query, not the first. Option 3 is an accusatory statement and most likely will make the client mistrust the nurse's objectives. This should not be asked at this time. Option 4 is the third query the nurse could ask. Missed work time is important, but to treat the client, the HCP must be aware of the attempted treatments. Agravida G1 P0000 is having her first prenatal physical examination. Which of the following assessments should the nurse inform the client that she will have that day? Select all that apply. 1. Pap smear. 2. Mammogram. 3. Glucose tolerance test. 4. Biophysical profile. 5. Complete blood count. The correct answers are 1. Pap smear and 5. Complete blood count. At the first prenatal visit, pregnant clients will undergo complete obstetrical and medical physical assessments. The assessments are performed to provide the healthcare practitioner with baseline data regarding the health and well-being of the woman, as well as to inform the healthcare practitioner of any medical problems that the mother has that might affect the pregnancy. A breast examination will be performed by the practitioner to assess for abnormalities, but since mammograms are potentially harm-producing X-rays, they are ordered only in emergent cases. A glucose assessment will likely be performed at the end of the second trimester. A biophysical profile may be done, but not until the third trimester.
While the nurse is delivering abdominal thrust to a 6-year-old who is choking on a foreign body, the child begins to cry. Which of the following should the nurse do next? 1. Tap or gently shake the shoulders. 2. Deliver back slaps. 3. Perform a blind finger sweep of the mouth. 4. Observe the child closely. The correct answer is 4. Crying indicates that the airway obstruction has been relieved. No additional thrusts are needed. However, the child needs to be observed closely for complications, including respiratory distress. Tapping or shaking the shoulders is used initially to determine unresponsiveness in someone who appears unconscious. Delivering chest or back slaps could jeopardize the child's now patent airway. Because the obstruction has been relieved, there is no need to sweep the child's mouth. Additionally, blind finger sweeps are contraindicated because the object may be pushed further back, possibly causing complete airway obstruction.
The nurse teaches the client with urinary diversion to attach the appliance to a standard urine collection bag at night. The most important reason for doing this is to prevent 1. Urine reflux into the stoma. 2. Appliance separation. 3. Urine leakage. 4. The need to restrict fluids. The correct answer is 1. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent urine reflux into the stoma and ureters, which can result in infection. Use of a standard collection bag also keeps the appliance from separating from the skin and helps prevent urine leakage from an overly full bag, but the primary purpose is to prevent reflux of urine. A client with urinary diversion should drink 2,000 to 3,000 milliliters of fluid each day. It would be inappropriate to suggest decreasing fluid intake. The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reyes syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. The nurse is completing the preoperative checklist for a client diagnosed with a herniated disc. Which information is a priority for the nurse to notify the operating room staff? 1. The client is reporting a headache. 2. The client is allergic to iodine and aspirin. 3. The client has not had anything to drink. 4. The client's hematocrit is 43%. The correct answer is 2. The client is allergic to iodine and aspirin. The standard surgical scrub is a povidone iodine antiseptic skin preparation. This should be brought to the attention of the surgical nurse who will be preparing the surgical site so that a substitute can be used. The client's report of a headache occurs frequently when clients have not been able to eat or drink, especially caffeine drinks. This is not a priority at this time. Clients going to surgery should be NPO for several hours to prevent aspiration during anesthesia. Option 4 is a normal hematocrit level. A client enters the prenatal clinic. She states that she missed her period yesterday and used a home pregnancy test this morning. She states that the results were negative, but I still think I am pregnant. Which of the following statements would be appropriate for the nurse to make at this time? 1. Your period is probably just irregular. 2. We could do a blood test to check. 3. Home pregnancy test results are very accurate. 4. You should repeat the test in 1 week. The correct answer is 2. We could do a blood test to check. Because quantitative pregnancy tests measure the exact quantity of human chorionic gonadotropin in the bloodstream, they are more accurate than urine tests that simply measure whether or not the hormone is present in the urine. Similar to the urine tests on the market, qualitative serum tests detect whether or not the hormone is present, but they are still considered to be more accurate than urine tests.
When teaching the parents of an infant how to perform back slaps to dislodge a foreign body, which of the following should the nurse tell the parents to use to deliver the blows? 1. Palm of the hand. 2. Heel of the hand. 3. Fingertips. 4. Entire hand. The correct answer is 2. Back slaps are delivered rapidly and forcefully with the heel of the hand between the infant's shoulder blades. Slowly delivered back slaps are less likely to dislodge the object. Using the heel of the hand allows more force to be applied than when using the palm or the whole hand, increasing the likelihood of loosening the object. The fingertips would be used to deliver chest compressions to an infant younger than 1 year of age.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A female client who has a urinary diversion tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm not normal. I don't see how I can go out in public anymore. The most appropriate nursing goal for this client is to 1. Manage her anxiety about her health. 2. Learn how to care for the urinary diversion. 3. Overcome feelings of worthlessness. 4. Express fears about the urinary diversion. The correct answer is 4. Express fears about the urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggesting that she discuss these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about this situation and may be feeling worthless, the underlying problem is a disturbance in body image. There are no data to indicate that the client does not know how to care for the urinary diversion. After receiving the change of shift report, which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. The client diagnosed with low back pain is scheduled to have a steroid injection into the intrathecal space. Which statement by the client indicates the client understands the procedure? 1. I will have to curl up like a Halloween cat. 2. This procedure will cure my back pain. 3. I will have an injection in each of my hips. 4. There is no risk with this procedure. The correct answer is 1. I will have to curl up like a Halloween cat. Intrathecal indicates into the central nervous system via a lumbar puncture. The client will be positioned with the back arched, much like a Halloween cat, for the HCP to be able to insert the needle between the vertebrae. The procedure provides temporary relief of inflammation of affected nerves. The injections are into the intravertebral space, not into the hips. An injection in the hips indicates an intramuscular injection. There is risk with any procedure. In this procedure, nerve damage is the greatest risk. Because nausea and vomiting are such common complaints of pregnant women, the nurse provides anticipatory guidance to a 6-week gestation client by telling her to do which of the following? 1. Avoid eating greasy foods. 2. Drink orange juice before rising. 3. Consume 1 teaspoon of nutmeg each morning. 4. Eat 3 large meals plus a bedtime snack. The correct answer is 1. Avoid eating greasy foods. The stomach is extra sensitive during pregnancy, so the pregnant woman should try to avoid foods that will aggravate it even more. Most fatty, greasy, fried, or other generally unhealthy foods are not going to help settle the stomach. These make morning sickness worse. Saltine crackers should be eaten before rising. Drinking orange juice has not been recommended. Although consuming ginger may help to alleviate the nausea and vomiting of pregnancy, neither cinnamon nor nutmeg has been shown to alleviate the symptoms. It is recommended that mothers eat small, frequent meals throughout the day.
A 6-month-old infant has had a cardiac arrest, and the rapid response team has been paged. The charge nurse arrives in the client's room and observes a licensed practical nurse administering CPR to an infant. See the figure below. To assist the LPN with CPR, the charge nurse should 1. Take over rescue breaths with a rate of 1 breath per 5 compressions using a bag mask device while the LPN continues compressions. 2. Take over compressions using 1 hand while the LPN uses a mask device to administer rescue breaths. 3. Take over rescue breaths using a rate of 2 breaths per 15 compressions using a bag mass of ice while the LPN delivers compressions. 4. Take over compressions at 80 compressions a minute while the LPN uses a bag mass of ice to administer rescue breaths. The correct answer is 2. The charge nurse should first obtain a bag mass of ice and assist with CPR by giving breaths at 2 breaths per 15 compressions. The LPN is using correct technique by using 2 to 3 fingers on the chest to administer chest compressions. The encircling hand technique may also be used during 2-person infant CPR. The heel of both hands is used for older children and adolescents. The compression rate is at least 100 per minute.
A client has an ileal conduit. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleaned? 1. Salt water. 2. Vinegar. 3. Ammonia. 4. Bleach. The correct answer is 2. Vinegar. A distilled vinegar solution acts as a good deodorizing agent after an appliance has been cleaned well with soap and water. If the client prefers, a commercial deodorizer may be used. Salt solution does not deodorize. Ammonia and bleaching agents may damage the appliance. The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The client diagnosed with low back pain is prescribed morphine sulfate. Which interventions should the nurse implement? Select all that apply. 1. Discuss with the HCP starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. 3. Inform the client to rise quickly from a supine position. 4. Administer anticonvulsant medications around the clock. 5. Tell the client to call for assistance when getting out of bed. The correct answers are 1. Discuss with the HCP, starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. And 5. Tell the client to call for assistance when getting out of bed. Narcotic pain medications slow peristalsis in the small and large intestines, increasing the risk for constipation and fecal impaction. The nurse should discuss a bowel regimen with the HCP. The nurse should attempt to have the client quantify the pain so that the effectiveness of interventions can be evaluated. The numeric pain scale is one method of objectifying the pain. Rising quickly from a flat-on-the-back position could increase the client's pain. Some of the medications administered for back pain can cause orthostatic hypotension. The nurse should teach the client to turn on the side and push up on the elbow slowly when getting out of bed. The client may be taking antispasmodic and pain medications, but there is no reason for anticonvulsant medications. For option 5, tell the client to call for assistance when getting out of bed. A woman whose prenatal weight was 105 pounds, weighs 109 pounds, at her 12-week visit. Which of the following comments by the nurse is appropriate at this time? 1. We expect you to gain about 1 pound per week, so your weight is a little low at this time. 2. Most women gain no weight during the first trimester, so I would suggest you eat fewer desserts for the next few weeks. 3. You entered the pregnancy well underweight, so we should check your diet to make sure you are getting the nutrients you need. 4. Your weight gain is exactly what we would expect it to be at this time. The correct answer is 4. Your weight gain is exactly what we would expect it to be at this time. For women who enter the pregnancy with a normal weight for height, the expected weight gain is 3 to 5 pounds for the entire first trimester and approximately 0.8 to 1 pound per week from weeks 13 to 40.
When preparing to deliver back slaps to an infant who is choking on a foreign body, in which of the following positions should the nurse position the infant? 1. Head down and lower than the trunk. 2. Head up and raise above the trunk. 3. Head to one side and even with the trunk lower than the head. 4. Head parallel to the nurse and supported at the buttocks. The correct answer is 1. To deliver back slaps, the nurse should place the infant face down, straddled over the nurse's arm, with the head lower than the trunk and the head supported. This position, together with the back slaps, facilitates dislodgement and removal of a foreign object and minimizes aspiration if vomiting occurs. Placing the infant with the head up and raised above the trunk would not aid in dislodging and removing the foreign object. In addition, this position places the infant at risk for aspiration should vomiting occur. Placing the head to one side may minimize the risk of aspiration. However, it would not help with removal of an object that is dislodged by the back slaps. Placing the infant with the head parallel to the nurse and supported at the buttocks is more appropriate for burping the infant.
The nurse is evaluating the discharge teaching for a client who has an allele conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. The correct answers are 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it, and 4. I must use a skin barrier to protect my skin from urine. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight of the urine from pulling the appliance away from the skin. The nurse obtains this information when assessing a 3-year-old patient with uncorrected tetralogy of Fallot who is crying. Which finding requires immediate action? 1. The apical pulse rate is 118 beats per minute. 2. A loud systolic murmur is heard in the pulmonic area. 3. There is marked clubbing of the child's nail beds. 4. The lips and oral mucosa are dusky in color. The correct answer is 4. The lips and oral mucosa are dusky in color. Circumoral cyanosis indicates a drop in the partial pressure of oxygen that may precipitate seizures and loss of consciousness. The nurse should rapidly place the child in a knee chest position, administer oxygen, and take steps to calm the child. The other assessment data are expected in a child with congenital heart defects, such as tetralogy of Fallot. The nurse is administering medications to clients on an orthopedic unit. Which medication should the nurse question? 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. 2. Morphine to a client diagnosed with back pain rated as 6. 3. Methocarbamol to a client diagnosed with chronic back pain. 4. Acetaminophen with codeine 3 to a client diagnosed with mild back pain. The correct answer is 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. Ibuprofen is an NSAID. NSAIDs decrease prostaglandin production in the stomach, increasing the client's risk of developing ulcers. This client has a known risk of peptic ulcer disease. The nurse should question the medication and discuss this with the HCP. Morphine sulfate is an opioid analgesic. Opioid analgesics are administered for pain. The client is in the moderate to severe pain range. The nurse would administer this medication. Methocarbamol is a muscle relaxant. Muscle relaxant medications are administered to clients with back pain to relax the muscles and decrease the pain. The nurse would administer this medication. Acetaminophen is a non-narcotic analgesic, and when combined with codeine, a narcotic analgesic, the potency of medication for pain relief is increased. The nurse would administer this medication. When analyzing the need for health teaching of a prenatal multigravida, the nurse should ask which of the following questions. 1. What are the ages of your children? 2. What is your marital status? 3. Do you ever drink alcohol? 4. Do you have any allergies? The correct answer is 3. Do you ever drink alcohol? All of the possible responses are questions that should be asked of a pregnant multigravida, but only one is related to the client's needs for health teaching.
A nurse walks into the room just as a 10-month-old infant places an object in his mouth and starts to choke. After opening the infant's mouth, which of the following should the nurse do next to clear the airway? 1. Use blind finger sweeps. 2. Deliver back slaps and chest thrusts. 3. Apply for subdiaphragmatic abdominal thrusts. 4. Attempt to visualize the object. The correct answer is 2. The nurse should use mechanical force, back slaps and chest thrusts, in an attempt to dislodge the object. Blind finger sweeps are not appropriate in infants and children because the foreign body may be pushed back into the airway. Subdiaphragmatic abdominal thrusts are not used for infants age 1 year or younger because of the risk of injury to abdominal organs. If the object is not visible when opening the mouth, time is wasted in looking for it. Action is required to dislodge the object as quickly as possible.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client with an ileal conduit will be using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? 1. Baking soda. 2. Soap. 3. Hydrogen peroxide. 4. Alcohol. The correct answer is 2. Soap. A reusable appliance should be routinely cleaned with soap and water. The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. The charge nurse on an orthopedic unit is transcribing orders for a client diagnosed with back pain. Which HCP order should the charge nurse question? 1. Physical therapy for hot packs and massage. 2. Complete blood count and complete metabolic panel. 3. Hydrocodone PRN. 4. Carisoprodol POBID. The correct answer is 3. Hydrocodone PRN. Hydrocodone is an opioid analgesic. This medication order is incomplete. The nurse should contact the HCP for a time limitation. Physical therapy for heat and massage is standard therapy for back pain. There is no reason to question this order. For option 2, many medications can affect the kidneys or the liver and the blood counts. Baseline data should be obtained. There is no reason to question this order. Carisoprodol is a muscle relaxant and comes in 1 strength, so this order is complete. There is no reason to question this order. The nurse is assessing the laboratory report of a 40-week gestation client. Which of the following values would the nurse expect to find elevated above pre-pregnancy levels? Select all that apply. 1. Glucose. 2. Fibrinogen. 3. Hematocrit. 4. Bilirubin. 5. White blood cells. The correct answers are 2. Fibrinogen and 5. White blood cells. Fibrinogen levels will be elevated slightly in a 40-week pregnant woman because coagulation factors like fibrinogen increase to help prevent excessive blood loss during delivery. A 40-week pregnant woman's white blood cell count will be elevated above normal as a means of protecting her body from infection.
When performing cardiopulmonary resuscitation, CPR, which of the following indicates that external chest compressions are effective? 1. Mottling of the skin. 2. Pupillary dilation. 3. Palpable pulse. 4. Cool, dry skin. The correct answer is 3. With CPR, effectiveness of external chest compressions is indicated by palpable peripheral pulses, the disappearance of mottling and cyanosis, the return of pupils to normal size, and warm, dry skin. To determine whether the victim of cardiopulmonary arrest has resumed spontaneous breathing and circulation, chest compressions must be stopped for 5 seconds at the end of the first minute and every few minutes thereafter.
The nurse should teach the client with an ileal conduit to prevent urine leakage when changing the appliance by using which of the following procedures? 1. Insert a gauze wick into the stoma. 2. Close the opening temporarily with a cellophane seal. 3. Suction the stoma before changing the appliance. 4. Avoid oral fluids for several hours before changing the appliance. The correct answer is 1. Insert a gauze wick into the stoma. Inserting a gauze wick into the stoma helps prevent urine leakage when changing the appliance. The stoma should not be sealed or suctioned. Oral fluids do not need to be avoided. The nurse is providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal continuous positive airway pressure ventilation. Which assessment finding is most important to report to the healthcare provider? 1. Apical pulse rate of 156 beats per minute. 2. Crackles audible in both lungs. 3. Tracheal deviation to the right. 4. Oxygen saturation of 93%. The correct answer is 3. Tracheal deviation to the right. Tracheal deviation suggests tension pneumothorax, a possible complication of positive pressure ventilation. The nurse will need to communicate rapidly with the HCP and assist with actions such as chest tube insertion. The heart rate, crackles, and oxygen saturation will be reported to the HCP but are expected in RDS and do not require immediate intervention. The client is diagnosed with low back pain and is prescribed cyclobenzaprine. Which instructions should the clinic nurse teach the client? Select all that apply. 1. Take the medication just before leaving home for work each day. 2. Drink a full glass of water with each dose of medication. 3. The medication can cause drowsiness that will make driving unsafe. 4. Divide the dose of medication between early morning and bedtime. 5. Suck on hard candy if you experience a dry mouth. The correct answers are 3. The medication can cause drowsiness that will make driving unsafe, and 5. Suck on hard candy if you experience a dry mouth. Cyclobenzaprine is a muscle relaxant. The medication acts on the central nervous system and can cause drowsiness. The client should be warned not to drive until the client understands the effects on his or her body. Driving could be dangerous for the client and others. Taking the medication before leaving the house could be a danger to the client and others because this medication can cause drowsiness. The client should not be driving or operating equipment until the client has determined the effect of the medication on his or her body. There is no need to drink a full glass of water when taking cyclobenzaprine. A side effect of cyclobenzaprine is a dry mouth, so using hard candy is an appropriate intervention. An antenatal client is informing the nurse of her prenatal signs and symptoms. Which of the following findings would the nurse determine are presumptive signs of pregnancy? Select all that apply. 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. 4. Frequent urination. 5. Uterine growth. The correct answers are 1. Amenorrhea, 2. Breast tenderness, 3. Quickening, and 4. Frequent urination. There are 3 classifications of signs of pregnancy: presumptive, probable, and positive. Signs that are totally subjective or presumptive include amenorrhea, breast tenderness, quickening, and frequent urination. Signs that are objective but not totally absolute are termed probable and include alterations in uterine shape and size and softening of the cervix. Signs that are absolute or positive include hearing the fetal heartbeat, detecting fetal movement by a healthcare provider, and seeing ultrasound images of the fetal outline.
As part of a health education program, the nurse teaches a group of parents CPR. The nurse determines that the teaching has been effective when a parent states, 1. If I am by myself, I should call for help before starting CPR. 2. I should compress the chest using 2 to 3 fingers. 3. I should deliver chest compression at a rate of 100 per minute. 4. If I can't get the breaths to make the chest rise, I should administer abdominal thrusts. The correct answer is 3. To maintain the best perfusion, it is recommended that compressions be given at a rate of 100 per minute in a ratio of 30 compressions to 2 breaths for 1 rescue CPR. Children still are more likely to have had a respiratory arrest than a cardiac arrest and are more likely to respond to opening the airway and rescue breaths. Therefore, it is recommended that unless the collapse was witnessed, a sole rescuer should attempt 5 cycles of CPR before leaving a call for help. Using 2 to 3 fingers for chest compressions is recommended for infant CPR only. Abdominal thrusts are no longer recommended for unconscious victims.
When teaching the client to care for an ileal conduit, the nurse instructs the client to empty the appliance frequently. Which of the following indicates that the client is following instructions? 1. The skin around the stoma is red. 2. The urine is deep yellow. 3. There is no odor present. 4. The seal around the stoma is intact. The correct answer is 4. The seal around the stoma is intact. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Thus, if the seal is intact, the client is emptying the appliance regularly. The skin around the seal should not be red or irritated, which could indicate a leak. There will likely be an odor from the urine. Deep yellow urine indicates that the client should be increasing fluid intake. The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. The nurse is admitting a client with a diagnosis of rule-out Hodgkin's lymphoma. Which assessment data support this diagnosis? 1. Night sweats and fever without chills. 2. Edematous lymph nodes in the groin. 3. Malaise and complaints of an upset stomach. 4. Pain in the neck area after a fatty meal. The correct answer is 1. Night sweats and fever without chills. Clients with Hodgkin's disease experience drenching diaphoresis, especially at night, fever without chills, and unintentional weight loss. Early-stage disease is indicated by a painless enlargement of a lymph node on one side of the neck. Pruritus is also a common symptom. Malaise and stomach complaints are not associated with Hodgkin's disease. Pain in the neck area at the site of the cancer occurs in some clients after the ingestion of alcohol. The cause for this is unknown. The client with a seizure disorder is prescribed fosphenytoin. Which interventions should the nurse discuss with the client? Select all that apply. 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. 3. Encourage the client to decrease drinking of any type of alcohol. 4. Discuss the importance of maintaining good oral hygiene. 5. Explain the importance of maintaining adequate nutritional intake. The correct answers are 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. And 5. Explain the importance of maintaining adequate nutritional intake. The client should wear a medic alert bracelet and carry identification so that an HCP and others possibly providing care know that the client has a seizure disorder. The client should not take any OTC medications without first consulting with the HCP or pharmacist because many medications interact with fosphenytoin, an anticonvulsant. The medication may cause anorexia, nausea, and vomiting. Therefore, the client should maintain an adequate nutritional intake.
The nurse begins CPR on a 5-year-old unresponsive client. When the emergency response team arrives, the child continues to have no respiratory effort, but has a heart rate of 50 with cyanotic legs. The team should next 1. Discontinue compressions but continue administering breaths with a bag mask device. 2. Establish an intravenous line with a large bore needle while preparing the defibrillator. 3. Begin 2-person CPR at a ratio of 2 breaths to 15 compressions. 4. Begin 2-person CPR at a ratio of 2 breaths to 30 compressions. The correct answer is 3. CPR is done on children for a heart rate of less than 60 with signs of poor perfusion. Rescuers should use a 15 to 2 compression to ventilation ratio for 2 rescuer CPR for a child. Breaths without compressions are indicated only for respiratory arrest where the heart rate remains above 60. The AED/defibrillator should be used as soon as it is ready, but rescuers should not discontinue compressions until the device is ready for use. The ratio for 2-person CPR in adults is 30 to 2.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assessing the urine of a client who has had an ileal conduit and notes that the urine is yellow with a moderate amount of mucus. Based on these data, the nurse should 1. Change the appliance bag. 2. Notify the physician. 3. Obtain a urine specimen for culture. 4. Encourage a high fluid intake. The correct answer is 4. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit. Because mucus in the urine is expected, it is not necessary to change the appliance bag or to notify the physician. The mucus is not an indication of an infection, so a urine culture is not necessary. An adolescent with cystic fibrosis is admitted to the pediatric unit with increased shortness of breath and pneumonia. Which nursing activity is most important to include in the patient's care? 1. Allowing the adolescent to decide if aerosolized medications are needed. 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. 3. Placing the adolescent in a room with another adolescent with CF. 4. Encouraging oral fluid intake of 2,400 milliliters per day. The correct answer is 2. Scheduling postural drainage and a chest physiotherapy every 4 hours. National guidelines indicate that airway clearance techniques are critical for patients with CF. Thus, postural drainage and chest physiotherapy are a priority. National guidelines also indicate that children and adolescents with CF who are hospitalized with respiratory illnesses should be placed on contact precautions. Furthermore, people with CF should be separated from others with CF to reduce droplet transmission of CF pathogens. There is no evidence that increased fluid intake adequately thins respiratory secretions, and chest physiotherapy is the priority. The client asks the nurse, "They say I have cancer. How can they tell if I have Hodgkin's disease from a biopsy?" The nurse's answer is based on which scientific rationale? 1. Biopsies are nuclear medicine scans that can detect cancer. 2. A biopsy is a laboratory test that detects cancer cells. 3. It determines which kind of cancer the client has. 4. The HCP takes a small piece out of the tumor and looks at the cells. The correct answer is 4. The HCP takes a small piece out of the tumor and looks at the cells. A biopsy is the removal of cells from a mass and examination of the tissue under a microscope to determine if the cells are cancerous. Reed-Sternberg cells are diagnostic for Hodgkin's disease. If these cells are not found in the biopsy, the HCP can rebiopsy to make sure the specimen provided the needed sample, or, depending on involvement of the tissue, diagnose a non-Hodgkin's lymphoma. Biopsies are surgical procedures requiring needle aspiration or excision of the area. They are not nuclear medicine scans. The biopsy specimen is sent to the pathology laboratory for the pathologist to determine the type of cell. Laboratory test refers to tests of body fluids performed by a laboratory technician. A biopsy is used to determine if the client has cancer, and if so, what kind. However, this response does not answer the client's question. Option 1 can be eliminated if you know what the word biopsy means. Option 3 does not answer the question and can be eliminated for this reason. The nurse is preparing to administer the following anticonvulsant medications. Which medication should the nurse question administering? 1. Carbamazepine to the client, who has a carbamazepine serum level of 8 micrograms per milliliter. 2. Clonazepam to the client, who has a clonazepam serum level of 60 nanograms per milliliter. 3. Phenytoin to the client who has a phenytoin serum level of 26 micrograms per milliliter. 4. Ethosuximide to the client who has an ethosuximide serum level of 45 micrograms per milliliter. The correct answer is 3. Phenytoin to the client who has a phenytoin serum level of 26 micrograms per milliliter. The therapeutic serum level of phenytoin, an anticonvulsant, is 10 to 20 micrograms per milliliter. Because the client's level is above that range, the nurse should question administering this medication.
Which of the following breathing rates should the nurse use when performing rescue breathing during cardiopulmonary resuscitation for a 5-year-old? 1. 10 breaths per minute. 2. 12 breaths per minute. 3. 15 breaths per minute. 4. 20 breaths per minute. The correct answer is 1. Rescue breaths should be delivered slowly at a volume that makes the chest rise and fall. For a 5-year-old child, the rate is 10 breaths per minute. If the nurse is also administering chest compressions, the rate is 2 breaths for every 15 compressions.
After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? 1. Peritonitis. 2. Thrombophlebitis. 3. Husitis. 4. Inguinal hernia. The correct answer is 2. Thrombophlebitis. After pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Husitis is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision. The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. The client diagnosed with non-Hodgkin's lymphoma is scheduled for a lymphangiogram. Which information should the nurse teach? 1. The scan will identify any malignancy in the vascular system. 2. Radiopaque dye will be injected between the toes. 3. The test will be done similar to a cardiac angiogram. 4. The test will be completed in about 5 minutes. The correct answer is 2. Radiopaque dye will be injected between the toes. Dye is injected between the toes of both feet, and then scans are performed in a few hours, at 24 hours, and then possibly once a day for several days. In option 1, the scan detects abnormalities in the lymphatic system, not the vascular system. Cardiac angiograms are performed through the femoral or brachial arteries and are completed in one session. The test takes 30 minutes to 1 hour and then is repeated at intervals. Options 1 and 3 could be eliminated because of the words vascular and cardiac. These words pertain to the cardiovascular system, not the lymphatic system. Which data should the nurse assess for the client with a seizure disorder who is taking Valproate? 1. Creatinine and blood urea nitrogen levels. 2. White blood cell count. 3. Liver enzymes. 4. Red blood cell count. The correct answer is 3. Liver enzymes. Hepatotoxicity is one of the possible adverse reactions to Valproate, an anticonvulsant. Therefore, the liver enzymes should be monitored.
On finding a child who is not breathing, the nurse has someone activate the emergency medical system and then does which of the following first? 1. Clear the airway. 2. Begin mouth-to-mouth resuscitation. 3. Initiate oxygen therapy. 4. Start chest compressions. The correct answer is 4. When breathlessness is determined, the priority nursing action is checking a pulse and beginning compressions. After 30 compressions, the nurse opens the airway and gives 2 breaths. Oxygen therapy will not be initiated at this time because the child is not breathing. Also, administering oxygen therapy would interfere with providing mouth-to-mouth resuscitation.
A client who has been diagnosed with bladder cancer is scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit 1. Is a temporary procedure that can be reversed later. 2. Diverts urine into the sigmoid colon, where it is expelled through the rectum. 3. Conveys urine from the ureters to a stoma opening on the abdomen. 4. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is 3. Conveys urine from the ureters to a stoma opening on the abdomen. An ileal conduit is a permanent urinary diversion in which a portion of the ileum is surgically resected and one end of the segment is closed. The ureters are surgically attached to this segment of the ileum, and the open end of the ileum is brought to the skin surface on the abdomen to form the stoma. The client must wear a pouch to collect the urine that continually flows through the conduit. The bladder is removed during the surgical procedure, and the ileal conduit is not reversible. Diversion of urine to the sigmoid colon is called a ureterosigmoidostomy. An opening in the bladder that allows urine to drain externally is called a cystostomy. An unimmunized 7-year-old child who attends a local elementary school contracts rubeola. The child has 2 siblings, ages 9 and 11 years, who also attend the elementary school. Which action by the school nurse is a priority? 1. Exclude the child and siblings from attending school for 21 days. 2. Notify all parents of children attending the school of the exposure. 3. Recommend that the siblings receive the measles vaccine. 4. Recommend that the siblings receive measles immunoglobulin. The correct answer is 1. Exclude the child and siblings from attending school for 21 days. Rubeola is a highly contagious infectious disease with severe consequences that include death. The Centers for Disease Control and Prevention reports that 9 of 10 susceptible people with close contact to a person with measles will contract the disease. The incubation period is 7 to 21 days. Excluding the infected and exposed children during this period of time is a priority to prevent exposure of healthy children enrolled in the elementary school. Although it is important to notify the parents of the other children in the school of the exposure, limiting exposure of other children is the priority. Mumps, measles, and rubella vaccine administered within 72 hours of initial measles exposure and immunoglobulin administered within 6 days of exposure may provide some protection or modify the clinical course of the disease in unimmunized children. However, the priority is to prevent an epidemic by limiting exposure. The nurse is caring for a client diagnosed with acute myeloid leukemia. Which assessment data warrant immediate intervention? 1. Temperature 99.0 degrees Fahrenheit, pulse 102, respirations 22, and blood pressure 132/68. 2. Hyperplasia of the gums. 3. Weakness and fatigue. 4. Pain in the left upper quadrant. The correct answer is 4. Pain in the left upper quadrant. Pain is expected, but it is a priority, and pain control measures should be implemented. The vital signs in option 1 are not alarming. The vital signs are slightly elevated and indicate monitoring at intervals, but they do not indicate an immediate need. Hyperplasia of the gums is a symptom of myeloid leukemia, but it is not an emergency. Weakness and fatigue are symptoms of the disease and are expected. If all the answer options contain expected events, you must decide which is priority, and pain is a priority need. The client with a seizure disorder who is taking carbamazepine tells the clinic nurse, "I am taking evening primrose oil for my premenstrual cramps, and it is really working." Which statement is the nurse's best response? 1. You should inform your HCP about taking this herb. 2. It is very dangerous to take both the herb and carbamazepine. 3. Herbs are natural substances, and I am glad it is helping your PMS. 4. Are you sure you should be taking herbs along with carbamazepine? The correct answer is 1. You should inform your HCP about taking this herb. Evening primrose oil may lower the seizure threshold, and the dose of carbamazepine, an anticonvulsant, may need to be modified. Therefore, the client should notify the HCP.
A child has just ingested about 10 adult-strength acetaminophen pills. The mother brings a child to the emergency department. What should the nurse do? Place the interventions in the order of priority from first to last. 1. Administer activated charcoal. 2. Assess the airway. 3. Reassure the mother. 4. Check serum acetaminophen levels. 5. Obtain a history of the incident. 6. Complete a physical examination. The correct order is 2, 1, 3, 6, 5, and 4. Immediate care of the child who has ingested acetaminophen is to ensure airway, breathing, and circulation. Next, the nurse should administer activated charcoal. Acetylcysteine mucimist may also be used as an antidote. When the child is stable, the nurse should reassure the mother. Next, the nurse should perform a physical exam to assess the child for other health problems, and then obtain further information about how the child obtained aspirin. The serum acetaminophen level should be obtained 4 hours after ingestion.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. If the client develops lower abdominal pain after a cystoscopy, the nurse should instruct the client to do which of the following? 1. Apply an ice pack to the pubic area. 2. Massage the abdomen gently. 3. Ambulate as much as possible. 4. Sit in a tub of warm water. The correct answer is 4. Sit in a tub of warm water. Lower abdominal pain after a cystoscopy is frequently caused by bladder spasms. Warm water can help relax muscles. Ice is not effective in relieving spasms. Massage and ambulation may increase bladder irritability. While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. Acyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The nurse is completing a care plan for a client diagnosed with leukemia. Which independent problem should be addressed? 1. Infection. 2. Anemia. 3. Nutrition. 4. Grieving. The correct answer is 4. Grieving. Grieving is an independent problem, and the nurse can assess and treat this problem with or without collaboration. Treating infections, which require HCP orders for cultures and antibiotics, is a collaborative problem. The treatment of anemia is a collaborative problem. The provision of adequate nutrition requires collaboration between the nurse, HCP, and dietitian. The stem of the question asks for an independent intervention. If you understand the problem and the treatment needs, options 1, 2, and 3 can be eliminated. The client with a seizure disorder is prescribed phenytoin. Which statement indicates the client understands the medication teaching? 1. If my urine turns a reddish-brown color, I should call my doctor. 2. I should take my medication on an empty stomach. 3. I will use a soft bristled toothbrush to brush my teeth. 4. I may get a sore throat when taking this medication. The correct answer is 3. I will use a soft bristled toothbrush to brush my teeth. The client should use a soft bristled toothbrush to prevent gum irritation and bleeding. Gingival hyperplasia is a side effect of this medication.
When developing the ongoing plan of care for the parents whose infant died of sudden infant death syndrome, the nurse should plan to accomplish which of the following on the second home visit? 1. Allow the parents to express their feelings. 2. Have the parents gain an understanding of the disease. 3. Assess the impact of the infant's death on their other children. 4. Deal with issues such as having other children. The correct answer is 1. The goal of the second home visit is to help the parents express their feelings more openly. Many parents are reluctant to express their grief and need help. The goal of the first visit is to help the parents understand the disease and what happened. The first visit also provides time to help the parents understand that they are not to blame. Although it is important to assess the impact of SIDS on siblings, this is not the primary goal for the second visit. However, the nurse must be flexible in case problems involving this area arise. Typically, parents are unable to deal with decisions, such as having other children during the second visit, because they are grieving for the child that they lost. This topic may be discussed later in the course of care.
A client is to have a cystoscopy. Which of the following indicate that the client has developed a complication after the cystoscopy? 1. Dizziness. 2. Chills. 3. Pink-tinged urine. 4. Bladder spasms. The correct answer is 2. Chills. Chills could indicate the onset of acute infection that can progress to septic shock. Dizziness would not be an anticipated symptom after a cystoscopy. Pink-tinged urine and bladder spasms are common after cystoscopy. A 4-month-old infant boy is brought to the emergency department by his parents. He has been vomiting and fussy for the past 24 hours. On examination, there are circular bruises on his back. What priority assessment does the nurse anticipate? 1. Chest X-ray examination. 2. Ultrasonography of the head. 3. Electroencephalography. 4. Ophthalmologic examination. The correct answer is 4. Ophthalmologic examination. The history and physical examination suggest shaken baby syndrome. An ophthalmologic examination is indicated to determine if the infant has retinal hemorrhages characteristic of shaken baby syndrome. Electroencephalography may be indicated if there is evidence of seizures. Magnetic resonance imaging or computed tomography of the head can detect subdural hematomas. There is no evidence that would support the need for a chest X-ray examination. The charge nurse and the licensed practical nurse are caring for clients on an oncology floor. Which client should not be assigned to the LPN? 1. The client newly diagnosed with chronic lymphocytic leukemia. 2. The client who is 4 hours post-procedure bone marrow biopsy. 3. The client who received 2 units of PRBCs on the previous shift. 4. The client who is receiving multiple intravenous piggyback medications. The correct answer is 1. The client newly diagnosed with chronic lymphocytic leukemia. The newly diagnosed client will need to be taught about the disease and about treatment options. The charge nurse cannot delegate teaching to an LPN. For option 2, this client is post-procedure and could be cared for by the LPN. For option 3, this client has already received the blood products. This client requires routine monitoring, which the LPN could perform. For option 4, the LPN can administer antibiotic medications. The client has increased intracranial pressure, and the HCP orders a bolus of 0.5 grams per kilograms IV of 25% osmotic diuretic solution. The client weighs 165 pounds. How much medication should the nurse administer to the client? The correct answer is 37.5 grams. To determine this, first find the client's weight in kilograms. 165 pounds divided by 2.2, which equals to 75 kilograms. Then, multiply 0.5 grams by weight in kilograms. 0.5 multiplied by 75 kilograms, which equals to 37.5 grams.
When planning a visit to the parents of an infant who died of sudden infant death syndrome at home, the nurse should visit the parents at which of the following times? 1. A few days after the funeral. 2. 2 weeks after the funeral. 3. As soon as the parents are ready to talk. 4. As soon after the infant's death as possible. The correct answer is 4. The community health nurse should visit as soon after the death as possible, because the parents may need help to deal with the sudden, unexpected death of their infant. Parents often have a great deal of guilt in these situations and need to express their feelings to someone who can provide counseling.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.